Good morning.
Good morning.
Hope you had your coffee. I am the State Superintendent, Emily Ann Gullickson, and just a few welcome remarks. We're so thrilled to have our amazing commission members here in the audience and also so many online today. We are really proud at the Virginia Department of Education that our work continues. Thank you to all of those commission members who have been diligently participating in and contributing to our work groups. You're going to hear more about some of those actions. And we are so excited that today's focus is on economic development. You have some great panels and information ahead. Today, we are thrilled to note that we just hit 100,000 page views on the VQB5 website. So what does this mean? Parents are actively seeking information on the options that work for their needs, their preferences, their home. And so huge kudos to the team. That site is working and parents are accessing it to figure out what options work best for them and their families. And then lastly, I wanted to just shout out Virginia in the national spotlight. So our agency team, especially Jenna and Becca, have been on the road being featured with other agencies, convening around the country, being able to spotlight Virginia's model of a robust public marketplace of options for families driven around quality, what our VQB5 looks like. And so really fantastic to be in the spotlight. And lastly, there is a great PN3 report and case study on Virginia. It highlights Virginia's transformation in its early childhood system, both short-term and long-term ROI for kids and families and our state as well. And so if you want to learn more about that, the Virginia Early Childhood Foundation team has that accessible if you want to dig in. But it is a testament to this commission and all of the work that you all do in a bipartisan way to champion options for families from our infants, toddlers, up even through school age. So with that, I'll kick it over to our co-chair, Doug Pointer.
Good morning, everyone. It is a pleasure to be with you all again for our second full meeting of the commission this year. Before we get started, a few housekeeping notes to point. They're on the slide here, just as a reminder. We are all here and ready to be engaged and work together at our tables. And we have a large online work group today. A lot of our members are present online. So for those of you who are joining us virtually today, members of the staff team are monitoring the Zoom room for questions or comments. And would just remind you, you will need to unmute so that we can hear you here. And then please mute yourself again to keep down on noise traffic in the room. After we call the roll, Co-Chair Delegate Bulova will go over our goals for today's meeting and its relationship to the Commission's charge. Our facilitator, Elliot Regenstein, is here again at the back table. He'll recap our shared values for our last session as we keep in mind things for our two panels today. The first panel is going to provide perspectives on the intersections of financing strategies and economic development in the Commission's work. We'll debrief the first panel and then break for lunch before hearing from our second panel on the importance of revenue stability and infrastructure. We will have the opportunity to again grapple with those before we come back together as a larger group. Finally, we'll reaffirm the Commission's shared values in preparation for our first draft of recommendations for our September meeting. Should members of the public have comments for the Commission, we've held time at the end of the meeting before we adjourn. At this time, I'm going to take roll. As I call your name, please reply here if you're in the room. If you are attending by Zoom, I would remind you, we do need you to unmute, reply here, and state the location from which you are joining. All right, Delegate David Bulova. Here. Delegate Ellen Campbell.
Here, from Waynesboro, Virginia.
Thank you. Delegate Mike Cherry. Here. Delegate Carrie Pointer, I'm here. Delegate Cliff Hayes. Senator Adam Evan. Here. Senator Mamie Locke.
Here.
Senator Bill Stanley.
Here in Franklin County.
Senator David Suederlein. Secretary of Education or designee Allison Buckner.
Here from Richmond.
Chief Deputy Secretary of Education Emily Ann Gullickson. Secretary of Labor Brian Slater or designee Billy Reed. Ashley Allen. Belinda Astrop.
Present, Emporia, Virginia.
Thank you. Jason Alcubi.
Here.
Simon Fiskus.
Here, Madison, Virginia.
Shakiva Frazier. Kathy Glazer. Edmund Hughes.
Here.
Kristen Kane. Erica Knowles.
Here.
Kayla LaFawn.
Here.
Ken Nicely.
Here from Murdoch County.
Todd Norris.
Here, joining from Pawleys Island, South Carolina today.
I'm jealous. Nicholas Palacio.
Here from Stanton, Virginia.
Jenny Poor.
Yeah.
Stacy Parham. Benita Petrella.
Here from Ocala, Florida.
Joan Sally.
Here.
Travis Staten.
Here.
Gary Thompson. Kevin Waddles. Rachel Williams. Elizabeth Randall Winkle. All right, hardest job of the day is over. And so now I'm going to turn over to my co-chair, David Bulova.
All right, thank you very much, Carrie. I do believe that I got the easy part of the job. So anyways, today, just wanted to set up kind of expectations and ground this within the context of the mission of the commission. So we're going to hear from a range of perspectives from across the state about the different challenges that are being faced to deliver early childhood education. And then also, I think mostly important is not just challenges, but options and solutions that have been adopted within our regions in order to be able to address those challenges. As you participate in today's sessions, we're asking that you reflect on one very important component of the Commission's charge, and that is to provide recommendations for financing a comprehensive birth to 5 early childhood care and education system. So assuming that there aren't too many people who are willing to do this for free, I can think of one person in our family, that would be my mother-in-law, and even that has a limit. The question then comes down to, what does it take to fund the early childhood education system that we envision, right? That we've envisioned together for our families, and then what kind of tools do we have at our disposal to create those partnerships and make sure that we are stretching our tax dollars as far as humanly possible. So that is the focus of today, really getting at that core mission of how we fund this process, because we can talk and we can envision as much as possible, but we also know that there's the economics with respect to how do we provide the foundations for a quality early childhood care system. And so with that, I'm going to hand it over to Elliot, who is going to recap our previous meeting.
All right, well, I share Delegate Bulova's enthusiasm about today's panels and hope that all of you find them a useful learning experience. As we go into them, we wanted to take a little bit of time to just recap the conversation we had last time about values, because as we're listening to these panels, one of the things we want you to have at the front of your mind is how, given the values that this group has articulated, how does everything that you're hearing lead you to sort of proposed strategies for moving forward, right? Like, we had a conversation that was relatively high level. Today, we're going to get a lot more specific, but that we want to view all of those specifics through the lens of the values we've articulated. So to recap those from the July meeting, right? One of the things we talked about was quality and compensation. right? And appreciating Delegate Bulva's points about that no one is willing to do this for free, with the possible exception of some in-laws, although there the costs tend to be psychic more than financial, perhaps. But that as we are thinking about financing strategies, right, how are we empowering childcare employers to recruit and train talented early educators in classrooms to ensure that they are delivering high quality experiences for young children and accessible services for families, right? One of the distinguishing aspects of Virginia's system is the focus on classroom level quality, and that does not come for free, right? So how do you make sure that your financing strategies are allowing you to attract and retain the talented educators needed to do that? Another core value that we talked about is access and choice, right? Are we financing the system in a way that allows all families who need it to access quality care that is affordable, right? And we've talked about that families have a role to play here too, but how do we make it so that families can afford high quality services? And are there good options in their community, right? We talk about mixed delivery and choice. That requires options, right? So how are we making sure that those are available? In terms of value and return on investment, as we think about the investments needed for Virginia's system to continue to be nation leading and to even grow in that position, how do we make sure that stakeholders understand how this benefits the state as a whole, right? That it's not just the individual children being served who benefit from our system, but that it's all of us in multiple different ways. And in terms of stability, how do we make sure that that system is in fact stable and predictable? And what are the benefits of stability and predictability? And what are some of the costs of not having it, right? Which are, again, things that we talked about at the last meeting. So all of those core values and key questions are things that, again, like this group generated, and that we want to make sure they're still front of mind for you as we go into these panels. I want to pause there because we're going to be talking about these values a lot today. Does anyone have any questions or comments or feel like that summary didn't quite capture any of it? All right, good. So with that said, I will now turn it back to Delegate Bulva to start our first panel. And we'll also flag as the panel is going, be thinking and taking notes. Delegate Bulva was probably going to say this too, but since I'm going to be coming back to help facilitate the conversation, really important that if you have any notes, take them down, and we will come back and discuss them when the panel is complete.
All right, let's get our panel members up here on the stage. Jason. You're kind of key to the discussion. And do we have Angela? Oh, she's online? Yes. Okay, perfect, great. All right, very good. So really excited to have been asked to help moderate our two panels today. As was mentioned, our first panel is focused on financing strategies and the role of childcare in supporting local economic development. And so we've got four really great people who are going to lay out their experiences, their expertise, and then help us to really focus in on what some of those tools and levers might ultimately be with respect to the commission's work. To get things kicked off, really glad to have here somebody, actually none of these people should be unfamiliar to any one of you. That's the great thing about the commission is that we do have the expertise here. But first we're going to hear from Jason Alcubi with the Virginia Economic Development Partnership. In addition to his many responsibilities, and I have the pleasure of meeting with him once every couple of months, and he wears many different hats and is very important with respect to Virginia's economic development. He also has served as the co-chair for the Shovel Ready Task Force over the last year. And so what he'll do is offer a summary of their recently released report findings and recommendations, along with any other insights that you want to be able to provide. Just so that you know, there are copies of that executive summary at your tables. And so feel free to peruse that as Jason has his presentation. And then as a parting gift, feel free to go ahead and take that home, and you can go ahead and read it as a bedtime story to your children as part of early childhood education. Next, we're going to hear insights from 3 individuals who are really implementing these concepts and ideas and strategies at the ground level. And so this is really, really important. So we first have Edmund Hughes, the Executive Vice President of Huntington Ingalls Industries, and he's going to talk a little bit about the Virginia Chamber of Commerce's blueprint. And so I believe you just have released the latest version of that. And so we're excited to hear that has a focus on early childhood education. Travis Staten, President and CEO of EO Companies. And so I learned something really fun, which is EO stands for go in Latin. And so that's really, really cool. And he's going to talk about their work in economic and workforce development. And then Angela Wells is the Executive Director of the Center for Early Success. And she's going to talk about the economic impacts from the microporous win for Southside Virginia. And so it's really cool to see some of the interrelations here, because I remember when Jason was talking about this as far as MEI. So a really, really important project. I think $1.35 billion investment, 2,000 jobs. And so how to make sure that as that company moves in, that we have that childcare that the workers and the parents are going to be expecting as part of that development. As you listen, your mission is to jot down responses to the following questions. And so it would not be an early childhood education commission meeting if we did not have sticky notes. And so there are sticky notes at your table, but the 2 things that we'd like you to be able to write down, and it'll help with Elliot's facilitation, is based on what you heard from the panel, what 1 to 3 things do you think are the most significant gaps, right? And so what are the financing issues that we need to consider and address that aren't being addressed today? And then what is the number 1? And I won't yell at you if you want to have number 1 and number 2. Most promising financing strategies or levers that the commission should prioritize, with the idea that these are going to drive the recommendations that will be in the commission's report to the General Assembly. So what are the most promising mechanisms and levers that we have at our disposal that we want to flesh out and have that ultimately conveyed on to the General Assembly? And so with that, thank you all for being here. Jason, the floor is yours.
Well, good morning, everybody, and thank you for that introduction. Can y'all hear me with the mic? I want to make sure that the folks online can hear us up here. Yeah, I'm seeing a few nods. The mic is working. The mic is working. Folks online. Okay. Well, good morning, everybody. Jason Alcubi here with VDP. I want to set the stage with a few thoughts. The first is that as we think about early childhood education, this is an area that directly contributes to the state's economic development strategy. One of the biggest things that we have heard in the economic development space over the last few years is that we need to deepen the ties between economic development and talent in workforce and education. We've done that at VDP by establishing a new goal for the state's economic development strategy, and we've done this very collaboratively. And specifically, we've talked about that as positioning Virginia as America's top state for talent in reality and in reputation. The good news is that Virginia is starting from a great position of strength. We've done so many things over many decades to make Virginia a leader in talent development and workforce development. When we ask the question, what does it really mean to be America's top state for talent? Fundamentally, it means at least 3 things. It means that, first of all, we need the people. We need to attract and retain people, particularly in a national environment where our population is unlikely to grow at the same rate as it has through all of our lifetimes. We're going to see more competition among states for people. Secondly, we need to really nail alignment. We need to make sure that Virginia is one of the top states in America for aligning the things that we're doing within our education and workforce activities with the evolving needs of the labor market. And then finally, we need to do everything we can to unlock barriers that keep people out of the labor market. We need to make sure that for the working age people we have in Virginia, that they're able to fully participate in the labor market as much as they can. I will say that that childcare, early childhood education advances all three of those goals. In fact, I was looking at some of the national research recently. Fertility rates in America are at sort of an all-time low. They are below the replacement rate. I think a woman today is expected to give birth on average, I think, to 1.6 children, which is not enough to actually grow our country's population. There's a number of reasons for that. Two of the reasons that we should be very aware of, that we do have some control over as leaders in Virginia, are, first of all, the price of housing. That is, the price of housing is causing people to think about having smaller families. And then the other is the price of childcare. It is expensive. And so we have a major effort in our economic development strategy to really tie this aspiration to position Virginia as America's top state for talent to our economic development strategy. And the work that we are doing here together is a major part of that. So thank you for being partners in that effort. I will also draw your attention to, before I talk about the task force, I do want to just draw your attention to some coverage that I was looking at this morning. The Wall Street Journal this week is doing a kind of a major profile on the costs of raising a child in America today. And I will say that one of the most interesting things I've read on this subject, and I've been spending a lot of my time on this over the last year. There's a story that is in the Wall Street Journal today, and the title of it is "Childcare in America is Broken. Here are 5 ideas for how to fix it." The work of the task force that I'm about to describe to you is very consistent with some of the ideas in this article. I will also mention that there's sort of an accompanying piece today on how much daycare costs across America. They do a 5-year, sort of a 5-year thing. Turns out that some of the localities in Virginia are some of the most expensive places for childcare in America. And just to give you a sense of the range, this estimate is, and this is for 5 years, so 5 years cumulatively, anywhere from $24,000 to $147,000 for 5 years of childcare. That is the cost. So we're talking numbers that in some places are equivalent to the cost of sending somebody to 4 years of higher education. So let me tell you a little bit about the Shovel Ready Virginia Task Force. This is in your materials. This task force has been at work for the last year. We just wrapped up our work. The task force did. The work continues, not through the task force, but through other mechanisms, and I'll tell you about that. But the basic idea of the task force was to get a group of leaders together to look at this issue of childcare and early childhood education through lenses that aren't typically applied to it. This can be a very sort of siloed part of our economy, a siloed part of our society. And what the task force did was pull together people who come with different lenses. So we had business people, we had civic leaders, and basically we wanted to take a fresh look at childcare. Your materials describe who was on the task force. I had the pleasure of being the co-chair along with Mike Chin, an entrepreneur and business leader in the Charlottesville area, along with many others, including some of you in the room today. I will say that, and I'll spend most of my time here talking about the recommendations that came out of that effort, but I would say that one of the big just sort of observations is that this is sort of paradoxically a part of our economy that for You know, anybody except for the very wealthy would be considered a major, major expense. So this is really expensive. And yet when you look at like where that money goes, the wages that are being paid to the folks who are providing childcare and early childhood education are a pittance. And as a result, we're seeing very, very high turnover. You guys have heard that, you're familiar with it. We've spent time on that as a commission, but it is just, you spend a little bit of time looking at this and it is just staggering, you know, how much it costs and yet like what that looks like for the people who are actually doing the work. So we spent a year at this, looking at this from different angles. We heard a lot of national experts. I should acknowledge Kathy Glazier and the team at the Virginia Early Childhood Foundation. They were absolute stars in this work. We convened this task force under the auspices of the Virginia Business Roundtable for Early Education, which is what it sounds like. It's a group of business leaders that are helping to champion this cause. The recommendations we've made are being taken by that group, the Virginia Business Roundtable for Early Education. We've asked them to sort of be the champions of this going forward. So let me just talk about the recommendations very briefly. We covered a lot of ground as a task force, but we distilled this down into three recommendations. So the first is to stop talking about childcare as sort of this sort of siloed thing, this thing that, you know, moms need to sort of get by. We need to talk about childcare as something that is really essential to Virginia's economy and quality of life priorities. This is really core to where we need to be. And I will tell you that same sentiment is expressed today in the pages of our sort of leading business newspaper, the Wall Street Journal. I think more and more people, as I was sharing with some colleagues in our work this morning, more and more people I think are waking up to this idea that this is really kind of core to what we need to do to have a functioning economy and a functioning society in the 21st century. Secondly, we need to accelerate the supply of classrooms and sites and other environments to deliver the kinds of childcare services that we need. The physical spaces in which this work happens are a major part of the cost, first of all. They are constrained, and this is also an area where we need a very significant creativity around, you know, how do we provide these spaces and these locations in a way that kind of works for the people who are involved in this, the parents, the kids, the employers, the communities, and so forth. And then finally, perhaps most vexingly, we need to substantially upgrade the capabilities within the childcare industry and the stature of the early educator profession. This is an industry where the business model is kind of broken. And you know, I alluded to that a second ago in terms of describing just how expensive it is and yet how poorly most of the people involved in this are paid. And it's going to, you know, this is a, you know, sort of a state and national moonshot, if you will, to upgrade the capabilities of this industry. We don't have all the answers for how to do that, but clearly this is a place where a paradigm shift is going to be necessary ultimately to create the kinds of outcomes that we would all like to see. So that's sort of the big picture. There's several ideas under each of these. I will also add, it is very clear that every single state is struggling with this. This is not a Virginia problem. There's so much to celebrate in terms of the progress that we've made in Virginia. You guys have heard about that. So, you know, don't take anything I've said as like, you know, Virginia is doing a bad job on this. This is just a large national challenge where Virginia has an opportunity to continue to lead, thanks to the great work of the folks in this room and many others who are part of this cause. So thank you.
Great. Thank you very much, Jason. And I think we're slightly ahead of schedule. So I did have a quick question. You had mentioned the article about 5 things that were broken and how to fix them in the system. I'm curious how those married up with or overlapped with your report's findings and recommendations.
Yeah, I will tell you, Delegate Bulova, that they really align quite well. So I'll just read you the headlines here, and I would encourage you all. I'd encourage all of you to check this out. So number one, first, understand the underlying economic problem. Like really do the work that we're doing and the work that the task force has done. And you know, in some ways it's simple. Childcare is expensive because people are expensive, and the ratios don't make this easy. You know, in so many places you need, one person can't take on that many kids, especially really little kids. And it does not lend itself to automation. AI and robots will not change a diaper. Secondly, figure out the best ways to train and equip teachers. This is the sort of thing where, like, if you put Jason L. on the case, like, it is not going to go well. You need to go into this with real training, and real training takes training, and there's an investment in that training, and there's a lot of other ways for these people to make better money. Third, give tax breaks and business training. In so many cases, the people who are running these businesses, and these are for the most part businesses, in so many cases, you have businesses that are not run by sort of business people. And so that goes back to the sort of upgrading of the capabilities of this industry, which, by the way, is really tough because, as we all know, it's a very fragmented industry. I mean, we are doing this in America through, a zillion small businesses. I mean, that's an oversimplification. Fourth, get buy-in from companies. Employers want to solve this problem. This is creating all kinds of headaches, absenteeism. It makes it harder to find workers. Many more companies are doing on-site childcare. And then lastly, very consistently with the first point I made, change the way America thinks about childcare. In the US, daycares and preschools have typically been viewed as babysitting service. The K-12 system, on the other hand, is seen as a public good. And so that's a direct quote. So that's the direction we need to move in, very consistent with where our task force has landed. Thank you for the question.
Yeah, thank you, Jason. And just following up really briefly on that one. So obviously has huge impacts on our economy. And I think one of the things about the MEI process is that you look at, return on investment, you look at the quality of the applicant. Is that something that we can do with early childhood education with respect to how we look at the state funds and the private funds and how all this works together? And so if our goal is to have a quality system, how hard is it to figure out kind of the larger economic model and refine that and use that as informative to our budgeting at the state level for that?
It's a great question. I don't feel totally qualified to answer it. I would maybe open that question up to others in the room. I think the answer is yes. I mean, there's got to be a way to do it. I don't think it's a simple thing.
Great. All right. Well, thank you very much. All right. Next up, we're going to hear from Edmund Hughes, and he's going to be then followed by our 2 panelists. Thanks for joining us.
Well, good morning. Again, my name is Edmund Hughes. I'm the Executive Vice President and Chief Human Resources Officer for HII. In addition to those responsibilities, this year I have the true honor and pleasure of serving as the co-chair for Blueprint Virginia 2035. And I do that with Monica Smoot. Monica is the president of Anthem Blue Cross Blue Shield of Virginia. So we serve as the co-chairs for Blueprint Virginia. What I want to do is give you a little bit of background on the process for Blueprint Virginia, how it's been used over the years. The actual blueprint document will be presented on December 5th at the chamber meeting. So the final report has not been completed. I will not steal the thunder of Blueprint, but there are some key themes that have come up so far that I want to share, and it reinforces everything that Jason just said. So what I want to do is take a few moments and talk about kind of the process that's used to gather the information, what's really presented ultimately, and Blueprint Virginia is really a grounds up process where the chamber goes truly across the state to all of the regions, and they have meetings with the business community, the chamber, business leaders, and they ask a series of questions. That's just part of it. There are also industry clusters that they ask a series of questions. There are also statewide surveys that are asked, and they just gather a lot of information on what the business community actually believes are some of the leading issues that need to be addressed. All of that information, it's consolidated. There's some pre-meetings that happen with the gubernatorial candidates where they kind of just spend some time with them and say, here's what the business community is thinking. Here are some of the top priorities that we're hearing as you're looking at your campaign. Here are some things that you may want to consider. This will be the fourth blueprint that's been presented. The first one was back in 2013. So this blueprint document, again, will be presented to the incoming governor on December 5th, whoever she may be, but it will be presented on December 5th. But what I want to do is just give you some information on kind of how the process works, how the information is gathered. So there are really a number of categories and focus areas that are included. One is just the business climate. The second is corporate sustainability. The third is education and workforce. The early childhood initiatives fall under education and workforce. Healthcare and life sciences, housing, infrastructure, innovation and technology, legal climate, and military and veteran affairs. So out of the probably 10 regions, I was able to actually attend 5 of those sessions. And one of the tools that they use is asking individuals in the crowd questions. Each person uses their phone and provides immediate feedback, and you see the data in a word cloud. What I found interesting in every single session that I attended, childcare was one of the items highlighted in every single session. And the more the word is mentioned, the bigger it shows up in the word cloud. Childcare is bold, large, and stands out as one of the many issues that the business community faces. As the Chief Human Resources Officer for a company that has 44,000 employees, childcare is a major issue for us. It's not only an issue for your current employee population that is just trying to find reliable sources of childcare, but as we look for new employees, and as Jason mentioned, the population for available labor is shrinking. So you want to be able to find as many individuals as possible to meet those needs. And if childcare is one of the items that are preventing you from finding reliable sources of employees, you want to do everything you can to ultimately fix those issues. So when we think of, with 44,000 people, 26,000 of them just sitting in Newport News, just replacing for turnover, you have a huge number of individuals. But let me go through some of the items that's come up in the actual survey. Now, this is preliminary information, and if any of you quote what I say, I will deny it to your face. But here are some of the themes and issues that have really come out. And as I said, the official report will be presented December 5th. And it's the fourth blueprint. And it is, kind of the blueprint that the chamber and the business community uses to address all the issues that Jason mentioned and those things that help make Virginia one of the leading states in the nation for business. And so, here are a few items that have kind of popped up. One was expanding access to quality, affordable childcare. Jason mentioned that one. Another one is focused on retaining talent and adequately compensating the childcare workforce. Jason mentioned that one. Another one is ensuring all eligible families have access to childcare and looking at the increased investments through all the kinds of services that are provided. Another one Jason mentioned was increasing speed to market for new childcare operators. So really expanding the horizons of what's available and how quickly can it get up to speed to cover all of those individuals who are looking and seeking childcare. So I don't think anything that I said was a surprise to any of the individuals in the room who have been working on those issues, but it will be one of the prominent items included in the blueprint going forward. So what I wanted to do is just give you some background information on one, Blueprint Virginia. It is the economic blueprint for the Commonwealth. And one of the issues that I know is near and dear to everyone in this room, the issue of childcare, and it will be one of the items that's ultimately covered in Blueprint. So thank you so much for this morning.
Great. Yeah. Thank you, Edmund. So again, we have a couple of seconds. I really appreciate the fact that you're using focus groups and getting that feedback from the business community. I wanted to get a sense of the risk factors that are involved if we don't step up to the plate and figure out some of these issues, right? And so again, proud, that Virginia seems to be ahead of the curve, but we're always competing with other states. Can you elaborate a little bit about, if we don't successfully address these issues, how that impacts businesses' willingness to expand, ability to expand, or whether they start to look to other states in order to be able to expand their businesses or locate their businesses?
So now you're getting truly my opinion and not that of the chamber or anyone else. As we look for talent as an employer, you want to remove any barrier that gets in the way of you finding individuals. And, you look at, well, who is the available labor source? Where are those individuals? What are they doing today? And in our case, many of the jobs that we have in high volume, probably half of our workforce are skilled trades individuals. And those individuals, the work is hard. It's hot in the summer. It's cold in the winter. But individuals can have robust careers, and the jobs do not require college degrees. With some of the recent wages that we've put in place, we're talking about a welder's job that's paying about $80,000 a year for an experienced individual. That's a pretty good wage. Now, what gets in the way of our organization being able to find those individuals? Yeah, childcare is one of those major areas, and you want to do anything and everything in your power that's going to eliminate some of those barriers. And if you can't find the people here, You're going to go where the labor exists. Will AI help in some of the areas where we do business? Absolutely. But it's not going to weld a ship. It's not going to paint a ship. It's not going to pull cable through a ship. We actually need people to do those kinds of things. So will technology improve productivity? Yeah, probably so. But it's not going to replace that labor piece. And you need a lot of bodies physically to do the work that we do. And anything that can remove barriers, I think we want to do those things. And again, making us competitive.
Great. Thank you very much. All right, next up, Travis Staten. Thank you for joining us.
Thank you. Good morning, Travis Staten, President CEO for EO Companies, nonprofit 501c3 headquartered in Southwest Virginia, and working on improving educational and economic opportunities through positioning all of our work on really what Jason mentioned is talent attraction, retention, and development. And I remember a few years ago speaking at one of the chamber events up here in Richmond, and Senator Kane was on the stage before me, and he shared a story about when he was governor that we were almost about to lose a company that was going to relocate to North Carolina. And he had a friend that was a site selector, and ultimately the governor did his work and was able to retain that company from relocation into South Carolina. But he asked his friend, the site selector, he said, how do you really decide where you want to go with those jobs? And he said, Tim, 90% of the time we already know. We put it out for bid among certain localities because we want the best support and infrastructure and cost sharing among those local governments to incentivize and entice us to come. He said, I understand that. Well, what's the big decision factor? And he said, 95% of the time, the labor force. And when we think about that and we think about attracting jobs to Southwest Virginia, we are extremely challenged. One of the, I'm going to say, more challenging parts of the Commonwealth. And we think about several years ago, sequestration and what that kind of did to Virginia's outlook with higher paying jobs. And next thing you know, we've got Go Virginia, a great initiative to bring higher paying jobs to the Commonwealth. And in order to do that, though, you have to have the labor force. And that's something that we had zeroed in on from a two-pronged approach. There's the future workforce. And I can assure you, and I believe everyone in this room believes that the earlier on in that continuum, the more prepared they are for kindergarten, the more likely they're going to succeed, the more return on that investment. The further down that continuum, the more expensive, the more challenging, the more harder it gets to fix. In addition to the future workforce, there's the workforce now. When we look at labor participation across the Commonwealth, we're probably averaging a little above 65%. In rural communities, they could be in the 50% range. Coming out of the pandemic, we learned that one of the largest barriers to getting people to re-enter the workforce from all of our employers and businesses was childcare. It's unfortunate that Southwest Virginia had the largest gap in access to care. At the time, is about a 29% gap versus a state gap of a little over 11%. When you think about the 9th Congressional District, Southwest Virginia, that's, I'm going to roughly say, about 500,000 in population, 29% gap, that's 7,000 slots that we're short out of 500,000 in population. So EO has a lot of lived and learned experience to pulling together what I'm going to say is a portfolio of systems and pilots and projects and initiatives to kind of build that ecosystem that is needed to look at this as an infrastructure issue, but also a talent development issue for the future workforce and a talent retention and attraction issue for today as well. We have worked very closely with the Virginia Early Childhood Foundation for quite some time and are extremely grateful for your partnership and participation. And that comes down to building initiatives such as historically a few years ago, we had some localities in the western part of the region that had zero licensed childcare. So if Jason were to call and say, I have an employer prospect and we want to bring them down and they're doing their due diligence and they can't really locate any childcare centers licensed on the map, that's the problem. So we partnered with DECF and the Appalachian Regional Commission, and over the course of a 24-month period, we brought on 10 new licensed providers that could provide care, became small business entrepreneurs that were subsidy eligible, that created more access for low-income families, and it was a great win. In addition, there's initiatives to build the labor force in the industry as well. You as employers often are looking for talent attraction and retention. So is the childcare industry. It sometimes isn't always about bricks and mortar. There are empty classrooms. I never forget being on a telephone call with some folks in Richmond, and a childcare provider said, we are competing with Taco Bell. And they said, what do you mean you're competing with Taco Bell? And they said, we pay $13 an hour. Taco Bell pays $15 an hour. So when you think about these spaces, tangible spaces, you also have to put teachers in those classrooms and having a talent attraction and really elevating that industry. We wrapped up recently a governor-directed project with the Workforce and Opportunity Act funding, where we were positioned to recruit, train, hire, and place 100 new educators into the field of early childhood education. We successfully recruited, trained, and placed more than 200 educators into the field, and getting them into the labor force, into classrooms, expanding that supply. We also recently, within the last 18 months, completed a 87,000 square foot major capital project to redevelop a former Kmart facility in Abingdon, Virginia, into a workforce and child development hub that includes a 25,000 square foot child care center, providing licensed capacity for up to 300 children. 21 classrooms. One of the most impressive pieces of that, it's got 4 infant rooms for 32 infants, which is unheard of in rural parts of Virginia because it's a 4-to-1 ratio. It's an expensive business model, but having economies of scale, having a center with 300 children, the back end where you have an 18-to-1 ratio or better capabilities in the business model help make that front end work. So we're thinking creatively about supply and the business models in building that. Additionally, we have launched a shared service alliance. When you think about the businesses themselves, working with 214 independent childcare providers as part of the Ready Region Lead, they often have good knowledge of classroom and working with children, but they're not sometimes the best at the business model. We learned that during the pandemic when we were helping them get access to grants and funding for temporary support to keep their doors open. And we would say, scan this, make a PDF and email it here. And they would say, what's a PDF? I don't have a scanner. We don't really use computers in childcare. So the Shared Service Alliance helps them understand their business model, helps them look at their budgets, helps them look at talent recruitment, attraction, helps them look at bulk procurement, things of that nature to help them run better, leaner business models. So ultimately they can pay teachers more, compete with the Taco Bells, and have that expansion and that sustainability. So it takes a system and a network. But there are a lot of good things that I think we're doing throughout the Commonwealth. And what I'm going to say is, instead of just always saying what's wrong, what's broken, how do we fix it, there's a lot of things that are working in some places. So how do we do more of them? And one of the most recent successful pilots that we have right now in partnership with another commission member, Ballard Health, is the Ready Together initiative, where we are partnering on a tri-share model with the VECF, DOE, and Ballard Health as an employer, where there's a cost share. They are actually investing in subsidizing care for their employees. If their employees are low income or eligible for state subsidy, there is a line there, and then the employee themselves actually contributes to that model as well. What we're finding is with everyone doing a little bit, it helps us help more people and helps those that need the help. Additionally, we are looking at opportunities to bring in a fourth leg of that stool, what we would refer to as a quad share, where there could be additional investment from localities, philanthropic individuals, or foundations that could be a fourth leg of that stool and help bring those employers into that space. We have experience working in that space, experience helping employers design and establish these benefit programs, but having state subsidy and other match dollars and investment makes that more attractive and makes that more an opportunity for those employers. So building all of those things in that ecosystem and helping look at it from a systems level, but there is a lot of numbers, a lot of math problems that come along with this, but also working through those public-private partnerships is very critical and also serves as the mechanisms and the modes. I do believe the private sector, the employers want to solve this problem. They're innovative, they're creative, and they're willing to invest, but we've got to take that step forward and work with them and not be the barrier within the bureaucracy ourselves of government, but how can we give them tools, resources, and carrots to co-invest and work alongside us to get those investments done.
Great. Thank you very much, Travis. I guess what I was really struck in terms of what you were talking about is just how unique each region is with respect to its economics, and then how hands-on you need to be in order to be able to put the pieces all together in a way that works. I guess it begs a question, is Virginia adequately funded and prepared to replicate that throughout the Commonwealth, right? And so again, realizing that it's going to take a linchpin, it's going to take people to be able to make those connections. Are we set up to do that, or do we have gaps in Virginia?
I would say Virginia has made tremendous progress. If you think about the amount of federal investment that was put into the early childhood care and education system, a little under $1 billion coming through the pandemic, and the General Assembly bipartisanly has made record investments, but the demand is increasing. There will always need to be more investment, but I think knowing that key piece of that ROI is important. One of the quicker, faster ways, in addition to more governmental support, I think, is again working alongside those employers, creating those incentives, those opportunities for them to co-invest and help scale and expand and deepen that investment, that it's not all on the state's shoulders to fund, and help spread that model.
All right, thank you very much. And then last, but certainly not least, we are very pleased to have Angela Wells here with us. Again, she's with the Center for Early Success, and is going to talk a little bit about her experiences down there in Southside Virginia, particularly dealing with the impacts in a good way of an MEI investment that is bringing a lot of new jobs in there. And so I know these companies, when they look at regions, they make assumptions that we're going to be able to have that workforce that's going to be able to come in and support their labor. And really glad to have you here to provide a perspective of how we're doing this in reality.
Thank you and good morning. I'm very grateful to be in this conversation today. I'm sorry I couldn't be there in person. I'm very proud to be representing Southern Virginia, where we're working on this every day, not just only as a support for families, but again, as a critical strategy for workforce and economic development. I want to start with a little bit of history of how we got to the conversation with Microporous. We had built a strong relationship with the Southern Virginia Regional Alliance, and that opened doors for us to engage directly in economic development and workforce planning. The big turning point for us came in 2024 when we were invited to speak to a workforce summit, and that led to conversations with both current and prospective employers throughout the region, and it helped us frame childcare as a key driver of the workforce attraction and retention. The big example that has been mentioned earlier today is the one about Microporous. Microporous, as you know, is a Tennessee-based manufacturer that recently committed to being in the Southern Virginia mega site. And during their selection process, we were invited to the table early. We sat in on those non-disclosure conversations. We were able to talk to them about the access to childcare, what childcare actually existed, and what it would take to have even more childcare so that they would have high quality workers available for them without those barriers. As a result of those conversations, Microporous engaged us into helping them write a grant with the Department of Energy for funding and committed $100,000 to address childcare needs as a strategic investment in their long-term success. We also have met with them and talked to them about other practical ways to support childcare, things such as childcare dependent care savings accounts, subsidy reimbursement for employees. Some of this you've already heard today, how to offset childcare costs, how to reserve childcare slots. We view their investment not as a donation or a one-time investment, but we view it more as a model, one that can be replicated with other companies. It could be replicated as a regional economic infrastructure. And while Microporous is one example, we have heard from other economic development offices within our region and companies that childcare is a deciding factor for them. We've had some other meetings with individual companies and organizations that have thought about things such as donating space, maybe retrofitting a space, but we also talked to them about how they don't have to be accountable for the childcare itself. They don't have to take on that liability. So there's conversations to be had around that. For many of these companies that are already operating, childcare shortages undermines their employee retention, their attendance, and their productivities. Parents can't find work if they can't find reliable care. And that's not just a family issue. As you know from the conversations today, it is a business issue, it's a regional growth issue, and it's an economic development issue. Since our work with Microporous, we've expanded our conversations past private companies. We're talking to school systems. We're also looking at having a regional symposium with faith-based leaders as to how they can be involved in these conversations. We're having conversations with Go Virginia and other regional coalitions. So we're really excited about this work. And specifically about this one example as to how it could be moved forward.
All right, thank you very much. I guess a question that I have is what is your timing on all of this? I imagine this is relatively short, and you're also dealing with kind of a chicken and an egg situation, right? Which is without the employers actually being there and hiring, you know, how do you get people willing to invest in childcare infrastructure or be interested in being childcare providers? So give us a little idea of what time frame you're looking at and how you've balanced those two things off.
Sure, and you're exactly right. It is a chicken and egg scenario because without childcare, you can't bring in the businesses, and without the businesses and families, the childcare can't operate because they need that income. With the Microporous example, we're actually working with them to design a request for proposal for childcare centers to be able to expand that are currently in operation. And that will be going out this fall around October is the last that we've heard about that. So, and that is long before that they are planning on breaking ground for that space. So initially that will go out, the investment funds will go out, and then we'll work with them diligently on the timing to make sure those slots are available when Microporous needs them or within the area. The other thing that we're doing is throwing a broad net. We're not just looking at childcare centers that are right where the mega site is, but maybe in surrounding areas throughout the region. Because we know workers are going to come from other areas other than just Pittsylvania County or Danville. We know potentially they may come from Lynchburg or Martinsville or other surrounding areas.
All right, thank you very much. Okay, so we've heard some really great presentations, and I just wanted to facilitate a little bit of Q&A. And again, remember that your role is ultimately to be able to write down on those stickies and help provide direction in terms of what is going to come out for recommendations from the commission. I think I forget which of our presenters mentioned, you know, the removing barriers element, and I think that's really, really critical. And what investments ultimately need to be made in order to remove those barriers. I can speak for myself and my fellow members of the General Assembly here that oftentimes our minds first go to, all right, how does the state solve this problem, either through legislation or through budget? And that's obviously a key part of what we're talking about, and we've made progress over the last couple of years. But I think what's been real clear is that we can't accomplish this without very direct private sector engagement. And so I think this is something that each of you can go ahead and speak to as we go through. But talk a little bit about, what is the proper role in the private sector for engaging the state, right? So how big of a bite do they need to have of this, or how much ownership do they need to have? And then how can Virginia incentivize that private sector involvement, right? So how much does it need to be? How do we pull the trigger on incentivizing it? So maybe we can go ahead and start with Jason. And then I promise the next question, we're going to do the opposite. So you have time to think.
It's a great question. I think about it kind of at two levels. I think there's the sort of the broad need for childcare. In other words, I don't think we're going to be able to solve this problem just by sort of working through individual economic development projects or individual businesses, in part because you have so many people who work for and run smaller businesses, and they're just not at a scale where I think this is going to be kind of a sort of a practical thing to do it only through, in other words, there's going to need to be sort of the broader infrastructure ecosystem of childcare. And in that, I think there might be some, sort of off the shelf ways, if you will, to incentivize smaller businesses, or perhaps even larger businesses that simply don't want to, for whatever reason, sort of do something that is sort of customized for them. So I think there's sort of that sort of widespread sort of ecosystem set of incentives that we should be thinking. I say incentives, but also just kind of frameworks for businesses to more kind of easily participate in the solution. I also think that for certain businesses that are doing, sort of a major expansion or a major new location, as you just heard about in the microporous example, I think we really do need to think about, like, what is the right sort of set of solutions for those cases where you've got a business that is contemplating, how do I recruit and hire many hundreds or even thousands of people over a short period of time, where we know that a large percentage of them are going to need some kind of a childcare solution, or where, that's going, and I think the part of the reason why so many businesses are thinking this way is because of what Edmund shared, which is that they see it as a competitive advantage. They know that, if they can pay a competitive wage and offer a childcare solution, that is going to attract and retain employees. And once they're there, it's going to make those employees, longer term, and absenteeism is going to go down. So, one of the things that I'm thinking about is how do we create a set of tools that makes it easy for Virginia and Virginia's communities to offer a solution to businesses that are in that kind of situation. You just heard about the microporous example. Kathy Glazier and I have had conversations on other economic development projects where, I called her up and I basically said, look, there's this company, and there's a big company, and everybody in this room knows the name of this company. They're looking at, doing, billions of dollars of investment and, many hundreds or even thousands of jobs in this case. And they want to do on-site childcare. And it turns out, like, when you're confronted with that challenge, we're sort of kind of, this is a little bit of an over broad brush, but we're kind of pulling together a solution from scratch. And so there's different models that are out there that are working, but, like, I think part of the answer here is I think there's a real value in our state and communities kind of developing a playbook for how do we do that. And, we could even make it part of our economic development solution for a project. One of the things that has really distinguished Virginia in the competitive economic development environment is that the General Assembly has invested in something called the Virginia Talent Accelerator Program. Thank you for that. And, you know, basically what it does is it provides the best solution in America of any state for helping a major business location or expansion project recruit and train the employees they need. It's part of the reason why Virginia's had so much success. You know, I think we could kind of use that kind of model as inspiration for thinking about how do we create sort of a childcare accelerator where we have like a really compelling, distinctive answer to that question. And it really addresses kind of at the heart of what most of these major business investment projects need to be successful, which is like, how do they get the people? How do they retain the people? And how do they make sure that the people consistently show up once they're trained? So I think about it in sort of the broad brush, developing the right infrastructure to, you know, kind of nurture the broader ecosystem. But like, how do we develop a playbook for you know, these major you know, sort of job creation opportunities that addresses not only the needs of the business, but the need of our evolving society.
Great. Thank you very much. Edmund.
You know, Jason really covered all the relevant points. When we look at this issue as a major employer with thousands of individuals in the same location, you know, one of the things that we have to keep in mind, we don't want to create within our own workforce the have and have nots, because with 26,000 people in one location, you're not going to find a solution that covers the bulk of the workforce. That shouldn't stop us from at least starting. And so we're going to continue as an organization to look at solutions for this item. And as I said previously, it is a key item in attracting individuals into our organization. It is definitely a key item in retaining and finding the workforce. We have not found that ultimate ideal solution. We're not going to stop looking either, because it is extremely, extremely important. And we want to be able to provide solutions that will allow us to provide assistance to as many individuals in our organization as possible. And that could be a range of solutions, but we have not pinpointed the ideal.
Great, thank you. Travis.
I think going back to Jason's comment on the competitiveness, when you think about if you are looking for a job or someone's looking for a job, most of the time you're looking at not just compensation, but benefits. Do they offer health insurance? That can be a big factor in why some people work where they work. I've heard people say, well, I work here because health insurance is better, but the pay's not that great. Why don't we think about that in benefits in early care and education? And so thinking about Ready Together and that mechanism, if we could do some really good case study to show businesses retention rates, attraction rates. If I've got two manufacturers and one offers childcare and one doesn't, or one offers assistance and helping cover that cost, I probably think they're going to have a competitive advantage that maybe the others will lift up and see we should be doing that as well. I do think that gets a little bit challenging with your larger corporations, sometimes that have multiple geographical locations or in other states, sometimes may say, well, we can't hit this in one place and not another. But, and I also think there could be some consideration, the larger employers, they typically can fund it and pay for it and are willing to do that. Your smaller businesses might need a little help to do that. And I think that's critical that we think about some of that, especially in rural communities. The small businesses are the ones that really help lift up those communities and our large employers collectively. And so figuring out ways to think about that.
Great, thank you. And so I think one of the things that I picked up on that is you know, we do talk sometimes about helping providers develop business models. And while larger companies probably don't need help trying to figure this out, for middle and smaller companies, they're going to have to understand how the numbers work too, in terms of that business model, and build the business case for why they need to be partners with respect to early childhood education, per your point about retention rates and employee satisfaction. Right. All right. Last, Angela, any additional thoughts on that as somebody who is living and breathing this stuff as we speak?
I actually will just add to a little bit of what was just said. And, I think many of them want to add benefits. So I think Travis alluded to this earlier, and having that shared business model where maybe they can come together as a group to be able to offer benefits at a lower cost. It's another additional piece to this.
Great, thank you. All right, and stick on there because I'm going to ask you the question first, and this is kind of a rapid response. So we've got 10 minutes to get through this and stay on schedule. But we want to now get real granular. We want to get as specific as possible. Jason, I know that you have your shovel ready thing, and you had mentioned kind of 3 big areas in terms of broad themes, but you also alluded to the idea that there were specific tactics and implementation items under that. As far as Edmund, I don't want you to reveal any state secrets, but my suspicion is that the blueprint also has some specific recommendations where you can come up with that. But the idea here is to help us out again, so we're visualizing conceptually, help us take it down to that implementation level, because when you're talking about budgets and how you're going to make this happen, you got to be able to distill it down to a couple of paragraphs and be specific enough in order to help people get a sense that, yes, this is real, this is doable. And so each of you, if you could speak to kind of the biggest cost gap and problem, right? And so if there's one area that you think is the greatest area of need where we need to focus on, and then, what is the number 1 or number 2 potential lever or strategy that would help to ensure success in supporting that public-private partnership. So if we could start with Angela.
Sure. So first, I think the biggest cost gap is the true cost of quality care for families, what they can afford versus what should actually cost for the providers to offer it to them. And then second, I think one of the most promising strategies we've seen is a blended funding model that we've already talked about, and that's combining public investment with employer contributions, community partnerships, all along the way. When I think about leveraging the cost of quality funding model, probably a multi-year public investment based on what actually costs to deliver childcare, pair that with the employer's partnership and shared services infrastructure is probably the best bet we have.
All right, thank you very much. Travis.
I'm going to go on the affordability component. Supply is important, quality is important, but you're not going to keep or maintain those if you don't have accessibility. In Virginia, median household average income is 90-some thousand. In Southwest, 42,000. 7% of 42,000 is roughly a little under $3,000. Divide that by 52 weeks a year. That means people in Southwest Virginia, to spend 7% of their income, should spend $55 a week on childcare. That's not doable. So I think figuring out those tools and those mechanisms to help with that affordability is going to be critical. And Ready Together, utilizing a tri-share model, I think helps, brings that private investment to the table. And if the state put a little more money into that, they would have way more co-investment than fully funding something like that.
So let me ask a more specific question, just because when we look at budget amendments, we often look at, what percentage of cost would we share? And we do know there's a tipping point, right? Where we can offer like 5% and most businesses are going to say, well, I'm not going to engage, because I'm covering the other 95%. Give me a sense of, in order to be able to entice private sector involvement, is there a tipping point? Is it a 50-50? Is it I'll do 25, but that's about as far as I'm going to go? And again, because we tend to think in metrics and formulas, and maybe that's a wrong way of doing it, because I think what we also heard was the need for flexibility in terms of developing this stuff, but help us think through that.
I think it needs some flexibility, and there's many different employers of size and scale and their capacity. I've seen the 50% model. I've seen the 25% model because there's someone else co-investing there. I believe if this commission could get back to the conversation that we had last year's, what is the real percent of income that someone should spend on childcare? That may be a good starting point when we think about these formulas and how to allocate and cost share with state and employer participation.
Very good.
Yeah.
Thank you. Edmund.
So ultimately, I believe the top two real issues that need to be solved is there's an issue of supply and demand. The demand for child care just greatly exceeds what's available, and individuals end up, I think it's someone said, I think you said it, you have your mother-in-law assisting in that process. So, I think first that issue needs to be solved from a supply and demand. And then to address that issue ultimately, if the issue is taking a job at Taco Bell versus taking a job where you're providing childcare assistance, we have to address that issue, because people are not going to pursue jobs that don't pay, don't compensate, but may be extremely, extremely rewarding. And people will do things that are personally very rewarding, but they're going to want some level of compensation for it. The exact how we solve it, organizations like ours ultimately have to examine how we're going to assist that employee population, and what is that true return on an investment. Are you going to build a facility of your own? Are you going to go in with other individuals? How are you truly going to be able to assist? And knowing that the issue is your ability to attract and retain individuals is the problem you're trying to solve.
Great, thank you. All right, Jason, take us home. And so just remember, here's your opportunity to talk about the biggest, is it cost gap? It could be a data gap, biggest problem area as you're looking at economic development from a statewide perspective. And then of all the things that you have from your report and the recommendations, what specifically would be most useful as from your perspective, as we're going into the 2026 session and beyond?
Well, I'll just say, I really do encourage you guys to scan the report, because there's a lot of good nuggets in there, and it's hard for me to pick just one. But I will say, on the cost gap, I mean, I really come back to this this compensation issue for the workforce that is providing early childhood education. I mean, the turnover rate here, I think it's like, we've heard this before, 50%. 50%, is that right? Can I get a nod? Yeah. 40%, says Jenna. So 40, I mean, just imagine running an organization where every year, 40% of your people are leaving. And it's such a personal thing. I mean, you're taking care of people's kids. Like, that is really, really tough. And so, like, and when you think about the sort of upgrading and capabilities that we need childcare providers to do in terms of the businesses, like, man, like, I just imagine if I had to replace 40% of my people every year, like, I would be drowning. Like, how do I do economic development if 40% of my people are leaving every year? Like, okay, so I would go there. I would go to, like, somehow, and the vexing thing about it is that it directly, it's in direct tension with what Travis rightly said. He is so right. The accessibility, the affordability, and yet, how do you solve that problem? He is so right. I'm so right. Like, how do you resolve this? That is why this is hard. So right. That came out wrong. And then, in terms of tactics, I mean, there really is a lot of good stuff here. I really like the idea, and the part I'm biased towards this because it's what I do, guys, but I really like the idea of creating a playbook, a set of tools that we can give to businesses. And I'm thinking about it from an economic development standpoint, because I want to put something in front of businesses that really distinguishes Virginia, that gets more businesses to choose Virginia. So I like that idea, but I think it'd be worth spending some time on that. I also think that, as we do that, we're probably going to come to some insights that, help us design things that would be helpful to all businesses in terms of how do we create a framework that makes it sort of easier for them to step up. We know this is expensive. We also know that businesses are likely to invest in it, given everything that we've heard today. If we can create sort of a set of kind of a framework, a set of, frankly, products that we can kind of market to businesses. So I really like moving in that direction.
Very good. All right. Thank you. Thank you all so much for your expertise and your insights. And before I turn things over to Elliot, let's give all of our panelists a big round of applause.
All right. Well, again, thanks so much to our panel for putting a lot of really good ideas on the table. And as we get into discussion, again, want to emphasize, we heard a lot from the panel that speaks to the values we articulated, right? I mean, there was a lot of talk about how we're going to increase access and provide choice, and also a fair amount of discussion about quality and compensation, right? And how those pieces fit together. So what we're going to do now, and we're going to do this a little differently than how we did group discussion last time. So hopefully everyone will follow the instructions, and hopefully I will deliver them correctly. But that basically what we want you to do is take a couple minutes to organize your thoughts, right? We had 2 question prompts focused on both sort of what are some of the biggest challenges, and then what do you think of as the most promising strategies. I will echo Delegate Bolivar, we're not going to restrict people to just one, but if you could put 1 to 3 ideas in each category, and you can draw on things the panelists said. You can obviously add your own ideas. That's what you're here for, and we're grateful for that. And so, and the questions are up on the slide, so that's very helpful. So take a couple minutes and get those organized, and then rather than have discussions by table, I'm going to ask people to share their thoughts with the whole group. And would love to hear as many different ideas as we can on each of these prompts. And then I will try to summarize what we heard, what are some themes we heard the most. And when I do that summary, we will ask for each of you, you will see that at your table you have green, yellow, and red cards. And we will ask that you hold up a green card if you think I've gotten it correct, a yellow card if you think I'm close but need a little work, and a red card if you think I'm totally off. For folks participating remotely, which I know is a pretty sizable group today, again, please do take a minute to organize your thoughts. We will want you to jump into the conversation. Maybe drop a note in the chat to flag for Karen or Rebecca if you want to say something, and I will keep an eye on them, and they will hunt me down to join the conversation. And then when we are doing the summation, if you can just put green, yellow, or red in the chat, that would be great. So does everyone think they understand the instructions? Good. So take a couple of minutes, organize your thoughts, your sort of top ideas on each of these prompts, and we will get going in just a minute or two with a group discussion.
So why can't we do the same thing? Like NCOs, involves, and how do you do that?
26.5 million capital, 81% privately funded, 19% public.
It's local public or
Businesses. It helped get the capital stacked up. 25,000 square feet operating. has licensed professional service with should be established.
If there's something else to say that as you go along with tuition for the kids.
Well, we have fixed the accessibility. So there's employers and also
All right, just take a few more seconds and then we'll come back together.
Some of them do upskilling or management complex. There's no research that leads to.
All right, let's get started. Focused on the first prompt. What are 1 to 3 things you think are the most significant gaps in financing that the commission needs to consider and address? And again, as we heard from the panel, right, the discussion was really, a lot of the discussion was really focused on, again, how can we invest intelligently to solve our problems, right? I mean, the total dollar figure will be debated by the General Assembly every year, but what we're really looking for as a group is to add our expertise of what are some of the highest leverage investments, what are some of the ways that we can use public resources effectively in a system where we know that public resources are only one part of the equation. How can we think about engagement with multiple different sources of funds? So as we ponder these questions, want to have that in mind and think about, to start with, what are some of the gaps? And is there any brave soul who's willing to start the conversation with what they identify as sort of the most significant gaps that we should be addressing?
I believe Edmund had already talked about this when he talked about compensation, and I had written it down initially. We're leaving children in the hands of people who are going to be with these children all day, yet we don't see them as a valuable resource. And that valuable resource is taking care of these children all day long. And we don't compensate them in a way that see them as a valuable resource. And I was talking to someone the other day who says the Chick-fil-A pays $20 an hour. And if Chick-fil-A is going to pay me $20 an hour versus being paid $12 an hour, then I'm going to go and work for Chick-fil-A versus paying $12 an hour. And that's why you have this 40% turnover. Because I'm going to go and work someplace that's going to compensate me for the value that I show to the workforce. So I think that we need to show support for early childhood educators and pay them in a way that values them for the work that they do.
Thank you. I wouldn't be surprised if other people also put compensation. Can I just see a show of hands of anyone who had compensation on their list? If folks can put in the chat if they're online, but I suspect that that's one that a lot of people had on their mind. John.
I've got a simple answer and I'm going to hand the mic to Travis. We reproduce the Kmart model and we do it all over the state. There's empty Kmarts all over the place and empty Sears. And Travis is going to tell you more details.
I think there's 3 areas in that. So
he's got it.
One is capital. Usually when you think about supply building, one of the biggest barriers is their outside of their food costs, their employee costs, it is facility costs. So if there are incentives and help to providers with the capital startup, I think in referring to Kmart, that's $26.5 million capital stack, 81% privately funded, 19% publicly funded, helping providers get that first initial capital stack kind of would help. Teacher compensation is an extremely important piece, as well as the ready together concept of working hand in hand with employers and cost sharing.
And then you had a mixed type of tuition, graduated.
Yeah. So in that center, it's got mixed delivery, it's got ready together, it's got subsidy, it's got all kinds of blended services and supports, but offering at that economies of scale.
So again, thank you, Travis. Did other people, who else had facilities on their list? Can I get a show of hands? Was that one that a number of people? Okay, so I'm seeing a few folks who had that. And then if I'm understanding the last point correctly, it was about essentially sort of creating incentives or reducing barriers to using multiple funding streams in the same facility, right? Like trying to encourage mixed delivery, not just sort of in the aggregate, but in the specific. Did other folks have that on their lists as well? All right, a couple folks. Okay, what are some things we haven't heard that folks want to talk about?
I had 2 items. One would be to put together site-ready incentives for localities to go find the best locations. Maybe it is a Kmart, but we also have a lot of churches that are vacant in a lot of communities now and other sites. I had a meeting with a locality yesterday and I said, I wish you would treat this like you were treating the biggest economic project you're trying to attract to your locality right now. Because if you approach this that way, you know, someone who had looked for a site for 2 years and then they were told it's probably going to be 18 months minimum to get through site plan approval. You've now told someone it's at least 3 to 4 years from the idea that you want to open this to get started. And if you had treated this like your biggest economic project, they would be opening their doors within 2 years if you could make that happen. So I think the way we incentivize localities to identify where they think the best locations are and decrease barriers with zoning and reuse of structures, and that we take on some of that front end would be helpful. And then the second thing, as VDOE, and they're identifying the top providers, right? Like you can see through data who's just doing an exceptional job, and perhaps looking at a state-funded mentor program for the best providers in regions to receive a stipend to help coach the next group of providers to expand might be a good way to naturally grow. As we heard the presenters talk about, it's not natural to be a business owner when taking care of children has been your thing. If we can find those superstars who are doing it and help them mentor someone else, that might be helpful.
Thank you. I love that we already have energy about promising strategies, which is sort of how, I mean, again, because I think what I heard you saying was some strategies for dealing with some of the problems that we've had already. So I want to come back to those, right? But I think at least the first one you were talking about is again, reinforcing the challenges of facilities. And the second thing you were talking about was about like, yeah, supporting providers. So again, I think consistent with the themes we've already heard in problem identification, and a great start to our discussion about promising strategies. Are there other gaps, right? Other holes in financing that folks on the commission want to put on the table?
Thank you. So one of the thoughts that I keep having just from discussions with folks, and I think that so much of what we do here is great in talking about, you know, the larger employers and the programs. But when we also talk to, you know, folks in the rural area that are a lot more likely to they're not that close to someone that's provided, even like with the discussion about something in Abingdon, you know, you talk about the 9th Congressional District. I live in the 9th Congressional District and I live 2 hours away from Abingdon. And there's other people that live 2 hours west of Abingdon and are still in that congressional district. So one of the things that keeps going through my mind that I think we should do, and just keep at least in the discussion for the informal programs where people are having someone down the street or a family member, is putting the money in the working folks' pocket to do that. And I think a great way to do that is through enhancing the refundability of the earned income tax credit. We finally started that 2 years ago, but it's still pretty modest. And I just think that that is something, one, you're giving flexibility to the people, but I mean, we know that a lot of these people are going to be choosing to spend it on their childcare. So I just hope that in the discussions, and I think I would love it if in our ultimate recommendations, that could be part of the discussion, but that's just something I'd like to put on other people's minds too. Thank you.
Thanks. So I heard both a new problem being put on the table and a new solution being put on the table, right? I mean, the problem being that in some rural areas, it's hard to get critical mass, right? And that the sort of larger center-based approach isn't likely to be successful. So you need to provide some sort of support for individuals, families to have care right where they are. And that earned income tax credit is one way to go about that. John.
This idea might not be very popular, but I'm sitting here thinking about, so if you're a mom, a dad, and you have a 5-year-old, time to start kindergarten, it's pretty easy to figure out where the child's kindergarten is going to be. We wouldn't think of not having a kindergarten or an elementary school in that locality. And where does that come from? It comes from personal property tax. I mean, there's already the funding method is there. The local people know that when their house is taxed, it goes towards the school system. Why can't we be thinking instead of K through 12, we're thinking a 3-year-old through 18-year-old and just start thinking bigger about this? And I don't think that would be the only funding source for it, but it would be a start.
Well, and that goes back to the conversation that we heard some of the panelists touch on of, the early childhood system is supported by a mix of funding sources, right? Federal, state, parent pay being the major ones. And that's a different distribution than in K-12, where local property taxes are a big part of the equation. And the question of what does the mix ultimately need to end up looking like in early childhood, recognizing that the federal government's only going to do so much, state government can only do so much, parents can only do so much, local government can only do so much. It's important to have all those factors as part of the conversation for sure. Mike.
I guess it's part one and part two. With one of the significant gaps sometimes I noted as a provider was getting the funds from the government. And I think the digital wallet is the thing that kind of bridges that gap. So one, it's the problem of getting the funding. Two, the commission should prioritize, I think, getting that digital wallet to make it easier for people to get the funds to the providers.
Right. So that's the gap, if I'm hearing correctly, is sort of the mechanics of how the system operates, and that the strategy is to have a digital wallet that allows the money to move more efficiently. I like very much that people are being solutions oriented. As a facilitator, I was probably supposed to be a hard ass about sticking to the first question, but I'm glad that we aren't doing that. So we'll open it up. Other thoughts on either of these questions, right? Like either gaps in financing and promising financing strategies and levers. Are we getting anything from online? I would encourage the online folks to jump in.
Yeah, thank you, Elliot. And I really liked some of the stuff that Jason was talking about in terms of flexible funding and the idea of recreating something for childcare providers along the lines of the Virginia Talent Accelerator program. I think something focused like that could be very, very helpful and kind of very similar to the idea of developing that playbook and then having the funds to be able to actually implement the plays once you've come up with something. Also really appreciated, because again, last year we considered, what kind of match could the state provide along with parents and along with private providers in terms of developing more accessibility with respect to certain businesses and getting private sector to be able to provide some of those costs. Liked the idea, and I forget who went ahead and mentioned this, of getting away from a state's percentage of the share and instead look at the affordability of the family, but also look at maybe a return on the investment kind of model, right? And so, look at, what could the state do? What could the private sector do based on, the relative benefits, to each of those different parties? And so then again, it would be flexible, but I think it would make sure that those investments are always a positive return. And at the same time, you're always looking at the family and affordability first.
I wanted to just add a point as you're contemplating these two prompts to Senator Suderline's point around really recognizing the portfolio of programs. And so when we talk about childcare, we're not just talking about centers, right? We're talking about, both school-based programs. We're talking about early Head Start and our Head Start programs, and we're talking about family childcare. And I just think that's really important that as Virginia has implemented and grown its 9 ready regions and scaled VQB5, that we probably support and measure more family child care programs than maybe any other state, like per capita. And as the superintendent was talking about VQB5 and those results being published, one of the interesting anecdotes that you've probably heard me share before, that the highest scoring site in the state last year was family child care in Northern Virginia. And the lowest scoring site in the state was family child care in Northern Virginia. And what that really sort of shows is that family child care absolutely can be of the highest quality. And as Senator Suderline was sort of talking about sort of both the informal options, but there's also sort of formal family child care. And that is really economically important for Delegate Bulova's district, where the cost of space is very expensive and many families speak different languages and prefer family childcare, to the Congressional District 9, where it is 4 hours to 4 hours across the district, and you're not going to have 300 kids within a 30-minute jurisdictional area. And so family childcare, where you can leverage the cost of space, right, because you're using your own home. And so when we think about things like the Talent Accelerator, I just want to make sure that you're not just seeing a center in your head, but you're thinking about how do we take the moms, the former teachers who are now staying home, and say, hey, would you be interested in being an entrepreneur and taking on maybe 2 or 3 more kids, right? And that is sort of dollar for dollar, both can be quality and can be cost effective. So just a little sort of reminder when we sort of say, you're thinking about the system, you're not just thinking about big sites, but are recognizing those family childcare, because we know that they're quality, regardless of what the stereotypes might be, and they are a huge part of the Virginia system, and they're the preference for our rural communities, for our parents of infants and toddlers, and for many of our English learner families as well.
So, sorry. To add to that, I mean, we had huge success when we did the partnership with Kathy and team and the ARC to bring on those 10 licensed centers. We searched high and low and found family day homes. The other thing about getting them licensed, they're on the map. Now they're subsidy eligible, but they came into the system for coaching and quality and all the other things that we can bring to the table. So in your rural localities, it is a tremendous asset and something we need to look at too.
For those of us that have children that were born 33 years ago, the family childcare option was really all there was. There was maybe a 1 or 2 kinder cares starting to pop up, but there weren't any centers. And that was Northern Virginia and Richmond.
All right, I think one of the promising levers is getting the message out on the new expanded federal tax credits for childcare. Small businesses are finally eligible, and I'm not sure how many of them know that. And then they increased the threshold for larger employers. And so I think that's definitely a great tool in our toolbox. And as we're thinking about the smaller employers, nonprofits, and others that aren't always on our radar, to build off of Delegate Cherry's comment on the digital wallet, it helps entice some of those smaller contributors who might only have 1 or 2 employees, who have an infant, toddler, or someone under 5, and make it more accommodating, flexibility on how frequent you're making contributions, what the contribution percentage is, instead of just sort of like a government flat rate. And so I just want to make sure we're not forgetting about our nonprofit community and our smaller businesses as we think about ways for them to also contribute alongside parents or any government support.
How are we doing on time? Oh, I'm sorry. Well, so let's try to wrap this up then. People had so many good ideas. How was I supposed to resist? Okay, so I am now going to summarize what I heard, and will then ask people to hold up a green card if they think it's correct, a yellow card if it's close but not quite, and a red card if you think I'm summarizing some totally different conversation. I will note that I have a hard enough time reading my own notes when I'm like sitting at a table, so if any of this doesn't come out quite right, if I'm close, please hold up a yellow card and we will try to resolve any differences as quickly as we can. Okay, so let me start with the first prompt. What are some of the gaps? And some of the gaps that we heard were compensation, right? That people are not being paid enough. Facilities are an ongoing challenge, that there aren't necessarily incentives to sort of get businesses involved that, you know, would be useful, that in rural areas, there are not enough, you know, there's not enough support for having services in sort of family settings and more intimate settings that are closer to where people live, that there are gaps in local funding, right? That like that's a part of the equation we haven't done enough of, and that some of the mechanics of funding are more complicated than they need to be and need to be simplified. So again, I'm not saying that everyone thinks of those problems equally or, you know, but that those are the things that have been identified in this conversation, right? Without committing you to any particular solutions to any of them. Does that seem about right? All right, anyone online not feeling the same way? Okay, so in terms of strategies to address those things, and these are not gonna sort of follow in the same order necessarily, but things we heard include working with localities, municipalities, right, on facilities and sort of thinking broader than just sort of individual buildings, but more at a community level. To provide mentoring and coaching supports for providers that can help them improve quality. The EITC as a strategy for potentially, you know, building capacity in rural areas. Talked about property taxes, and that led to some conversation about sort of the mix of funding sources, right? State, local, business, families. Like, again, we're not deciding today how to resolve that, but that was flagged as sort of a strategy of something we should talk about. The idea of the digital wallet to improve the mechanics of funding. Creating a childcare talent accelerator to help with personnel. And then also sort of engaging nonprofits and other community organizations in supporting family childcare and sort of childcare at the community level. And then also the federal tax credit and getting the word out about that as a possible source of revenue, you know, source of financial support for improving childcare supply. Again, not committing the commission to advocating for any of those things, but those are some of the things that I think we heard in terms of strategies that might address some of our gaps. Does that sound about right? Kathy's got a comment.
Just wanted to make sure we could add a little bit finer point about addressing the compensation, like through making sure that there's enough funding in reimbursement rates to not only build the quality of services, but also compensate the workforce fairly.
Thank you. With all that said, I saw some green cards, any yellow or red cards, any concerns that people have?
And this is just something to add into the mix, and I do it with a little bit of trepidation. But I think Jenna went ahead and brought up the very important issue that a lot of these aren't centers, they are going to be community-based, and anything that's community-based is also going to have an interplay with zoning and land use issues. And it's the same very painful conversation we're having with respect to housing affordability. I don't know that there's a simple solution, but it's probably something we ought to flag.
Thank you. All right, I have stood between you and lunch long enough. Please, members of the commission, get some food, and we will reconvene shortly.
Good afternoon, everybody. Y'all ready for the second session?
Yes.
Yes. All right. So everybody should have had lunch, which totally doesn't put you to sleep. It gives you lots of energy to help facilitate the conversation. But really grateful again to have another fantastic group of panelists. This time around, we are going to focus on the issues of infrastructure, and we're going to talk about revenue stability. And so really just want to mention in terms of the importance of revenue stability, and this is something that we see all the time, is that you have a one-time infusion of cash, and you're thinking, all right, this is going to make a difference, and then it winds up being a roller coaster. And so nobody is going to engage, no one's going to invest if they think that these investments don't have some stability or staying power over time, because it's really hard for a business to make investments if they don't have a reliable funding source. Very, very difficult for families if they can't rely on a consistent budget year after year after year to be able to make very important decisions about the education of their children. So these are really fundamental issues that if we are making investments, there has to be stability and they have to be well planned and allow people to budget accordingly. So first we have Sonia Waddell. She is the vice president and an economist with the Federal Reserve Bank of Richmond. She is going to speak to the economics of childcare and highlight her work and engagement with the Shovel Ready Task Force. Sonia is omnipresent. And so what I love about her is that her work really fits in with a lot of the issues that the General Assembly talks about. And so she is a frequent speaker at the Virginia Housing Commission, and we had talked a little bit about some of the challenges and how they interlap with respect to how to afford, basically the early childhood education, but also how do you go ahead and keep a roof over your head. Very interrelated issues, and so really glad to have your expertise at the table. And then we'll also hear from Jennifer Parrish of Peak Childhood Center, and Rupa Morty with the YWCA Sprout Schools. And they're going to talk about what it takes to make the economics work for the day-to-day operations of an early childhood care and education center. Again, we love our kids. We want to make sure they're educated, but a lot of these are small businesses and they have to be able to make the bottom line work in order for them to be able to ends meet and provide these very, very important services. So same with the last panel. As you listen, please jot down your responses and think about the questions that we're going to be asking at the end. And so just to refresh your memory, so, based on the panel discussion that we're about to hear, what are the 1 to 3 things that you think are the most significant gaps, with respect to data, financing, information, that the commission needs to consider in its deliberations. And then what are the 1 or your top promising financing strategies or levers that the commission should prioritize, again, with an eye on that part of our mission is to get this on paper, to develop a report that is actionable by the General Assembly, actionable by the governor and the administration. And so with that, welcome, Sonia. We're looking forward to your presentation.
There we go. Thank you for having me. Omnipresent is a little intimidating, especially given that I feel like I walk into any room and I'm rarely the expert. So being up here with Jennifer and Rupa is also a little bit intimidating in talking about childcare. I started thinking about this issue in part because I think I default to feeling that prices are an appropriate allocation mechanism for the goods and services in an economy. And there just seemed to be something about the childcare industry that wasn't working. And I go back to when I put my first child in childcare in 2011, I couldn't understand how we were paying so much money. And I can think about what we were paying in 2011, 2014. And I knew what the workers were making and how, like what, so we're gonna talk a little bit about that, about the cost mechanism that the providers are facing. But there actually is sort of an Econ 101 rationale that we might not have an optimal price set between a provider and a household. And I say that because of a lot of the things that we've already talked about with respect to ROI, right? There's a positive externality from early care and education. So if Rupa has a child and she puts her child into Jennifer's child care center, she is willing, her willingness to pay is not going to incorporate the benefit that I get from her child being in quality early care and education, right? And so we can talk about sort of the social benefits that we get, and I'm going to talk about that in a minute. Because the price that she's willing to pay is going to be lower. Jennifer is not going to be able to get from Rupa then the full benefit to society, to Rupa and to society of that early care and education. Okay, so that is like, you know, that's what we might call a market failure, right? That price itself is not going to be the allocation mechanism alone to think about sort of early care and education. But then, you know, okay, so what are those benefits? I mean, I think we've already talked about this, right? I think James Heckman is like the grandfather of sort of understanding the return on investment to early care and education. But, you know, there are a lot of studies that have been done. There are some treatment control type studies that were done, particularly on programs from the early 60s or early to mid 60s. The one that has actually had some papers come out recently, that Perry Preschool Project, you know, and I'm not going to like spend a lot of time on the literature, although I'm happy to do that, you know, at any point. But so there has been some work recently to look not just at the lifetime outcomes, the employment outcomes, the educational outcomes, the health outcomes, the reduced likelihood of incarceration from the kids who themselves were in that high quality care. There's actually work now, because this was in the 1960s, this program, there's work on the children of those kids, right? So it's not just that if Rupa puts her children in a high quality 0 to 5 environment, that her children will benefit, her children's children will also benefit. Though Rupa, I didn't mean to keep calling you out, but again, it's lower rates of incarceration, better health outcomes, better educational outcomes, better employment outcomes. And that's where sort of this social benefit of the quality early care comes in. And of course, we've already talked about this as well. But so at the Richmond Fed, we spend a lot of time on the ground. We spend a lot of time talking to employers, and Jason, as usual, took the wind out of my sails here. But labor force participation is going to be a challenge, right? So we are in an environment, because of the demographics of the country, because of the falling birth rate, because of the aging population, that we see labor demand exceed labor supply, and that is only going to, that is not, let me put it this way, that is likely to persist, right? So prime age men, so, you know, 25 to 54 in the US, the labor force participation rate has been sort of slowly falling for the last couple of decades, gradually, but it has been coming down. Women sort of topped out in the 90s at about 10 percentage points below men. And we have not seen female labor force participation come up. Of course, rural areas like Travis talked about, there are some areas of the country, actually rural or urban, that have also kind of lower labor force participation rates. So you can look at gender, you can look at geography. Now, of course, all of this is not early care and education, but it is a piece of it, right? It is a piece of it. And I liked the conversation about sort of our evolution, and I kind of mentioned this in the break, and I was convinced to include this, which is, you know, we have we had an economic unit 150 years ago that was the farm, right? And the whole family was working on the farm. Then we had these economic sort of units that were the businesses outside of the home. And then we had women mostly at home. Well, I mean, in some ways, sort of building up the infrastructure around early care and education is sort of the next step in our evolution, right? As we have sort of both parents working outside the home, not consistently. There's a choice piece that's important, but giving people that choice is important in the economy that we're trying to sort of sustain and build. So there's, like we said, the workforce of today, the workforce of tomorrow. But there are sort of so we can agree that maybe there's a market failure that comes from this positive externality. There's a high ROI on investing in early care, and then we need quality early care for today's labor supply, right? But what's another important piece to this, which again has been discussed a lot already today, and which Rupa and Jennifer will be able to speak to, much more articulately than I can, is sort of what this cost model looks like for providers, right? Again, there are some very clear reasons why it is expensive to provide early care and education, right? It is expensive because it is highly labor intensive, right? So we said, I think 60% or so of the cost of the average center goes to wages. And we know that those wages are not high per worker. You still have then that other 40% that maybe you can think about infrastructure, and we've talked about that. The high labor intensity also makes it difficult to find the productivity gains that maybe a Taco Bell or a Chick-fil-A or a Target can get, right? So in the last 5 years, the number of customers that any given Target employee can serve has gone way up, right? I mean, I don't know about, I spend a lot of time at Target, so I don't know about your Targets, but for me, they now have like one Target employee serving, somewhere between 6, 9, 12 sort of self-checkout, right? You can't get that in early care and education. So as we see the productivity sort of go up, it's not surprising that the wages in some of these, in a lot of the sort of lower wage jobs have come up in the last couple of years. And again, I mean, that's a whole nother conversation that we can have, but we haven't seen that in early care and education because there is no replacement for the teacher to child relationship. So that's another reason why we have to think sort of a little bit creatively about how we pay our teachers and how we sort of operate this cost model. And then, the kind of final thing, the final two things I'll say have also already been talked about, right? So there are economies of scale to childcare provision. Actually, when you combine the economies of scale to the teacher expertise, I think most of us should have our kids in early care and education. I will say my child care center, there's absolutely no way that I would have set up a sensory table for my 9-month-old or my 18-month-old for that matter. I think that there are a lot of benefits to the expertise and the economies of scale that come from sort of having multiple kids with a teacher. But that's also necessary to make the cost model work, right? And so when you're in a rural area, it can be harder to find the number of children that you need in order to sort of make that model work. And I'm sure Rupa and Jennifer will be able to talk to that. And then there's the mix of kids, which we've also already talked about, right? So like I said, we spend a lot of time sort of on the ground in the 5th Federal Reserve District talking to people. And I have not talked to a single childcare provider who makes money off of the infants. All of them say, hey, we lose money on the infants, but we can make that up. We can make this program sustainable because we have the 4- and 5-year-olds, which means our 3- and 4-year-olds, which means that like some of the incredibly well-intentioned public programs for universal preschool, in some cases, depending on how that program has sort of been built, can hurt the independent infant care providers. And we saw this, I mean, the example that comes to my mind is West Virginia, I think saw this a couple of years ago. So these are all of the pieces that I look forward to hearing Jennifer and Rupa talk about. So I think I will leave it at that.
All right, Sonia, thank you. And I'm going to put you in an impossible position with a question, if that's okay. You had mentioned, you started off with the idea of market failure. And so, we're not able to, in this context, be able to fully take into account externalities, avoided costs, with respect to incarceration rates or loss of economic productivity. And so I think we understand that. I guess the problem comes down to the fact that we've got a 2-year budget cycle in Virginia, which is twice as long as most other states that only have the one. And so it's hard to budget for that increased investment when the cost are going to be delayed for years. Are there other, so I guess the question is are there budget tools that we could use to do that? And if not in early childhood education, are there other examples where there's been market failures and you're able to go ahead and correct them or figure that out?
Yeah, I mean, that's a hard question. I will think more about that. We do kind of throw around a term like market failure a lot, right? And the fact that, some of the things that I just said do not necessarily represent a market failure. The fact that something is expensive to buy in itself is not a market failure. We don't think we can't all buy yachts, right? And those are expensive to buy and expensive to operate, but we don't see that as a market failure. I think, so we kind of have a dual challenge here, right? I mean, I think one is that, like I said, the pricing mechanism, there's like a willingness to pay piece to this, right? And that is true, right? And that's where the market failure comes in that positive externality. And that's a reason for public investment, I think. But the other piece to this is just the high cost of provision and therefore the high cost for the individual to pay, right? So, everybody who's on the Richmond Fed's insurance plan benefits from the fact that I try to work out every day, but the cost to me for that is pretty low, right? And so but the cost of the childcare is high. So then the question is, how do we, as a Commonwealth, or actually, like Jason said, this is something that all states are facing, think about the investment in sort of, again, centers is important. Home-based care is important in a lot of parts of the state. How do we think about that investment from a budget perspective? And that's a hard question for me to answer, sort of off the top of my head. So let me think about that a little bit, and maybe Jennifer or Rupa have some insights into that.
No, thank you. And I thought that was a really good response in terms of how do you account for long-term costs with short-term investments, realizing you've got to balance your budget every 2 years. So
yes, and that a lot of the benefits, like if we think about the workforce of today, okay, we get those benefits. If we think about the workforce of tomorrow, some of these benefits are going to come in like 18 years, right? Or 18 plus years, 20 years, 22 years. So it really is kind of the long term. And that's where I would turn, to economic development, someone like Jason, to say, hey, we can see the benefits of tomorrow as coming in today by getting the employers in here today, by growing the state. And then, but I mean, again, kind of calculating that ROI and then budgeting for it is pretty difficult.
perfect. All right, thank you. All right, next, we'll go ahead and turn things over to Jennifer. And so they're going to speak from the on the ground standpoint in terms of how do you take these larger concepts, that Sonia very well laid the foundation for and apply those to real world situations.
Great. Well, thank you. Thanks for having me here today. I'm going to give you first a little context about Peak and then talk a little bit about our business model. Having the context, I think, will help. So we are a nonprofit. We're down on the peninsula. We have 2 centers now. One is in Hampton and one is in Newport News. We just opened the Newport News one to children on June 4th. So it's very new. Our mission is to provide a high quality, affordable program to our families while making sure the children are school ready when they leave us. And we have children from ages of 6 weeks until they walk out the door for kindergarten. So we do support the infants as well. In terms of quality, we do participate in the Virginia Quality Measurement Improvement Program, and happy to say last year met expectations. And we are also NAEYC accredited as well. In our Hampton Center, we can serve up to about 120 children. And then in our Newport News Center, we'll be able to serve up to 200 children. We are not serving that many. We're at this point not up to full capacity. And part of the reason is because of the very reason we're in here this morning talking about the issues that we're talking about. So I'm hoping one day we'll get there. And finally, just a little piece of context to give you a sense, our budget, our last audited budget was $3.7 million. Just will help you know that as I talk now a little bit about the business model. So with that, in terms of our revenue, 49% of our revenue comes from government and grant funds. So included in the government funds is subsidy program, the mixed delivery program, and also USDA funding that we receive because we offer breakfast, lunch, and then an afternoon snack as well. We have unique partnerships with our localities, both the city of Newport News, city of Hampton, and in Hampton also Hampton City Schools. We have to cover very, very little of the cost of running our facilities. So that's a really important thing to know as I continue to talk through this. In terms of that 49%, we do chase after a number of grants as well. So that's not pure government funding there. And about 37% of our revenue comes from donors, from the fundraising that we have to do as a nonprofit. Only 13% of what we bring in is coming in from tuition and fees from our families with a 1% endowment. So that gives you a sense of the revenue. 85% of that goes right back into programs and services in the classrooms, with salaries and all of the personnel benefits being the majority of that 85%. Only 4% actually goes back into our fundraising, which I'm actually really proud of that low number. So enrollment is really driven by staffing, and also we clearly have to follow our ratio requirements to be licensed as well. But our biggest issue, which you've heard here this morning too, is the issue of teacher compensation. I believe that is why we have the hard time that we have finding staffing. It is the reason for turnover. Senator Locke mentioned that Chick-fil-A pays $20 an hour. So right now, if you start with us as a teacher with no experience, we're paying you just over $18. If you're starting with no experience as a teacher assistant, we're paying you just over $15 an hour. So that means our teachers are making just a little over $35,000 a year, and our teacher assistants just a little over $29,000 a year. So our teachers and teacher assistants, if they have children, they qualify for subsidy or the mixed delivery grant. And we need to really work hard to make that change for us. I also calculated recently, knowing that I was coming here. So when you look at our teachers' starting salary, they're only making 64% of what a teacher starting in Hampton City Schools is making. And our teachers do teach year round. So they're in the classroom year round versus the fact that Hampton teachers and many teachers across Virginia are on a 192-day contract. If you don't know, I am a retired school division superintendent, hence the reason I can throw those statistics out. So the other piece I want to talk about a little bit, but before I do that, I do want to add, because this literally happened just yesterday, the other thing that is now happening to us is we are losing our teachers to the public schools because there's such a teacher shortage in the public schools. So yesterday, a teacher of ours has been hired as a long-term sub. She doesn't have her BA yet. And as soon as she gets her BA, then they'll promote her up to teacher. She can make more money in the public schools than we can pay. She is not the first one that we've lost over the last couple of years. So that is really challenging for us right now as well. So we not only lose them to Chick-fil-A and Target, but we also are now losing them to the public school system. So a part of the private funding is that part I think is important for me to outline for you a little bit. We do have to raise about $1 million annually. That number went from 500 to $1 million when we opened that second center in this last year. And that money really makes up two major pieces of the revenue or offsets what we're not getting through that. So the first one I'll talk about is our families are all on a sliding scale tuition if they're paying tuition. And I did mention earlier, but at least 75% of our families are living below the federal poverty line. And oftentimes that percentage is much higher, but we do have in policy that it will always be at least 75% or more. So for our families on our sliding scale, a family living below 100% of the federal poverty line pays only $40 a week or $157 a month. So we really do provide that affordability. So our fundraising has to make up for what we're not getting to get to the true cost from the tuition that we're collecting from our families who have to be on the sliding scale. Important to note that we have families sitting on the wait list for subsidy that are in here now on our sliding scale until they can get onto the subsidy program themselves. The subsidy program is the other reason that we have to fundraise, because we have to fundraise to make up the 25% of the true cost of the quality program that we pay by fundraising, because we're not going to push any of that back on our families to pay for that. They pay for their co-pays as required, but we have to fundraise to make up that 25%. So that's where the fundraising really comes in, to offset what we're not getting through the government program, and also the sliding scale tuition that we put our children, our families on. We do, by the way, make sure as we fundraise that we bring people in on giving societies, as we call them in the nonprofit world. And for those, we have our donors pledging out to pay annually for 5 years. And this ranges from somebody who might be paying $5 a year for 5 years to somebody who might be paying $100,000 a year for 5 years. I stress that because we do that because we have to have sustainability in our fundraising. And that, to me, is the exact same issue we have to have in the government funding that we're receiving for subsidy and mixed delivery, is we've got to know that we have sustainability in those funds, that we know that they're coming to us every year, no matter what else is happening around us, both at the federal level and state level as well. So we're making sure that we do that. And I will tell you, people follow through with their pledges. Our auditors are incredibly impressed by that. So, but we need that to happen too with the funding that we receive from the state as well. Compensation, I talked a bit about that, but that is an incredible issue for us. As I have already said, you've heard what we make. I will tell you that we try and help our cause. We do offer health insurance. We actually offer 7% match for a 401k plan for our teachers, and then we offer paid time off. The vast majority of our staff is taking neither of those from us because it's still too expensive for them to be on our health insurance, and they can't remotely think about putting money in a 401k at this point. So my hope is we can increase compensation so that they can use the benefits that we're having to try and make quality of life so much better, keep them healthier, and planning for their future in terms of retirement. But I get it. You can't do that when you're making $15 an hour. But one day, that's my hope, that they'll actually be able to do that. They do appreciate the paid time off, but here's a problem that we have in early childcare. We don't have many substitutes. So when they take their paid time off, we have to make sure we can cover those classrooms so we stay in ratio. And so that's staff that we have to hire as well. That's equally as challenging. They come in at the same level if they don't have experience as a TA, starting at a little over $15 an hour. So that's just something that we think it's worth the benefit for the paid time off, but it's a challenge for us when we have quite a few of those teachers out. Again, what is just so important to us is that sustainability of funding, so that we know we can even plan in terms of knowing the benefits we're trying to offer and what we need to have so that we can continue to do so. Access for families is huge. Right now, we are not, we do not have one classroom open at the Hampton Center. We've had to sit on that, one, because finding staffing is a challenge for us, and we will only hire qualified staff. At the new center, we have 15 classrooms. We have 8 of those classrooms open right now. We're planning to go to 10 by early October, with doing the other 5 in the spring. And this is because, one, there's staffing, but we're sitting on the 5 for the spring to make sure we get through the state budget process, because I'm concerned in terms of what's happened with the federal budget, what that's going to mean for the state budget. Will it impact funding for childcare in the subsidy program or mixed delivery program, of which, if I didn't mention, we also participate in. And so we just need to be really conservative on what we're doing. And that's that issue again of knowing where those dollars are coming from the state budget that are such an important part of our program. So I'm confident we'll get those classrooms open, but I just can't have us open a classroom and then a month later have to close the classroom. We can't do that to our families. We can't do that to our staff as well. So I think that gives you a context of how we're operating in terms of our finances. And I know you all may have some questions, or we'll get some questions later, but thank you for letting me share a little bit about Peak.
Yeah, no, and thank you very much. And I know you would hit on a theme that we've heard throughout the entire day, which is with respect to compensation. And sounds to me like you've, instead of direct compensation, you're looking at other creative ways to be able to get people on board with benefits. I think the paid time off is one example. That had actually come up 1 or 2 years ago. I'm curious how you manage that, because you're correct, it is difficult to have to bring in somebody part-time. So is that something you do cooperatively with other centers? Is that something where you just have a person who is willing to, doesn't want to do full-time but wants to do part-time?
Yeah, we do have people hired as subs, so they don't want to work full-time, so we'll call them in when we need them. We do have floaters that are hired, knowing that we're usually going to have at least one person out, so they'll move throughout the days. But it's staffing that we do have to carry, and we do have to have people who are willing to come in and do the part-time work for us.
Great, thank you very much. All right, Rupa.
Well, I don't feel lonely. It sounds like our models are very similar. The YWCA Richmond has been doing childcare for over 137 years. My guess is we've had about 50 to 60 different models in that time. And for the last 10 years, we've run a model called the Sprout Schools. The Sprout Schools are our program for early education, high quality early education, full day, full year. And we do braid every subsidy available to us from the local level. The city of Richmond has a trust fund that does pay cost for infant and toddler spots to mixed delivery and subsidy that comes with families who enroll. We would accept Head Start. We don't have that opportunity in our city. We hope that that would, be something that we can expand back into as we were a partner in the Head Start for our city for about 50 years. So we also have some of the exact same challenges that you have. Our budget is very similar, about $3.7 million. We fundraise extensively. We have that background at the YW. The other program that we run at the YWCA is a domestic violence program. So we have a domestic violence resource center that provides everything from emergency shelter tonight to workforce development, et cetera, for folks to be able to survive and then thrive as head of household that have experienced violence. And so those two programs have actually been in the YW's work for the last 40 years together. And so a lot of this was about making sure that children had a safe place to be while their parent went out to work for the first time. And what we've seen is a lot of our employees, as you mentioned, are making what I would say is not a living wage any longer, especially with the new information around Chick-fil-A paying $20 an hour. I do have a 6-year-old son working at Topgolf who's making a little less than that, but the Sprout School employees are making somewhere between $15 and $18 an hour for doing much more high quality work with many more responsibilities, caring for our children. And so as I think about what we're saying to our workforce and what we're saying to folks that we want to employ is that the value of their child being cared for and not just a safe, but high quality circumstances, not as valuable as swinging the golf club at Topgolf tonight. So I want to really be clear about the models are so similar. Our budgets are actually very on par. We fundraise to make up that gap between subsidy. And we also understand as an organization that's been in the nonprofit business for 137 years that when you're not new and shiny, right, when you're not doing the new thing that philanthropy is really interested in, it becomes very hard to be able to sustain that dollar. And so whether it is the $1 million gift that came in to be able to build the building or run the two new centers, we have 5, run the 2 new centers, or it's the idea that, you know, our teachers now have to pay increased co-pays that weren't in their budget last year, right? Because of the changes that are happening at the state level. We have to consider all of those things. And so we're really trying to figure out what the best new model is. I don't think, and actually our model is a 50-50 split. So full pay families at our centers make up about 50% of our families. And the other 50% of our families are families that live at or below federal poverty lines of about 200%. The reality is I don't think that that's going to continue to exist because we don't have the ability to forecast what our you know, operations budgets are going to look like in the future. And so it is nice to have you know, a 2-year budget and sort of understand what that's going to look like. It is nice to be able to open new schools and be new and shiny on the block. And the reality is I suspect we'll be able to serve less families that are living in low wage households in the future. I think that'll probably look like 60-40. And we are doing a lot of work internally with our finance team, our HR team, and our operations team to figure out exactly what that payer mix is going to look like in the future. And I say that because, right, it's not just how do you operate the schools, it's then how do you operate the whole YWCA. And so that has become sort of this new conversation, and being able to have the experts, and I think we have incredible board members, we have incredible team members, being able to have the experts in business in our nonprofit to be able to forecast 5 years in the future on the operations of our sprout schools is something new and different to operating the YWCA. So we've got some challenges ahead of us. We do have, like you, open seats today. We've got nearly 100 seats not filled across our 5 schools. We have 300 seats available from 6 weeks to 5 years. And that is very, very much in part because of teacher retention, hiring high quality teachers, being able to train them, and then knowing that they will stay with us. We offer similarly paid time off, matching 401k. And I will say one of the things that I'm interested in, and I don't know the answer to, that I'm working with, you know, again, the smart folks on my team on, is what is it going to mean for Medicaid expansion and the changes that might come to healthcare for my employees, for our employees, to think about how they might need our resources, our benefits, and I want them to want them. But I also know that that is going to be a shift for our operational budget in the middle of a year that we were not planning for.
Great, thank you very much. 3 really wonderful presentations and perspectives. First question I wanted to throw out there, I think, is for Jennifer and Rupa. And so Jennifer had mentioned that with respect to your fundraising, I think that's to cover the 25% gap with respect to the cost of quality rates. I guess the question is for you, so if the state were to provide cost of quality rates at 100%, what would that mean for your business models in terms of who you'd be able to serve or how many people you would be able to serve?
So it would definitely enable us to serve more families because I think it would make staffing easier because we could increase the compensation. That's where that additional funding will go into, is really supporting our staffing. So it will make a huge difference. You know, the mixed delivery grant, which does pay the true cost of education, of quality education, has really been important to us. And once we were able to start receiving that money, we increased compensation for our teachers. So that's where that additional 25% will go. I do want to add, in terms of cost of quality, we do need to make sure that we re-benchmark that in a very regular interval. I'm not sure how long it's been since we've done that, but I suspect it's been a little while, and that true cost now is going to be even more than what it was going back to my superintendent days. You know, we do the re-benchmarking of costs for public schools. And so doing that for us in the childcare space would be important.
Yeah, I think if we were able to really live into that and know that it was a 5-year span, to your point around fundraising, that would be a game changer for us. We wouldn't have to retool on the yearly at this point, right? Thinking about a 60-40 split or 75-25 split on who we can serve because of how much money they make. We get to serve families who want high quality full day childcare. And that really should be the basis of everything we do.
Yeah, and thank you for raising the re-benchmarking issue. I'm reminded as we're going into the next session that we're going to be having a K through 12 re-benchmarking, and we want to make sure that we're keeping up with the costs, at least with respect to the state ends. I guess the second question for Jennifer and Rupa comes down to what would it take for you to serve more families? And so let's say all of a sudden you've got a microporous in your community and you've got tons of new jobs coming, but you're under the microscope to say, hey, how do we make sure that those families are served? What are the things that you would focus on first if you were said to come up with a plan for how you're going to maximize the number of people you're going to serve?
I'm glad you asked. It'll take about $20 million. The YW is actually building a new center. We're building a new center in Eastern Henrico. That is because the county of Henrico is investing heavily, again, those one-time funds to set up a new school to serve 100 families in the region. The reality of how many subsidy spots we'll have is going to come down to how our state and local governments work together to figure that out for us. What I'd love to see is a coordinated entry point, if I'm being really honest, and I think that would take away a lot of this guesswork. And so where families know that they can come to one place and enroll in childcare and have multiple options for them. And that is the kind of thing that becomes the game changer, because we're really being able to track what families need, what they're looking for, and the data that goes along with us to inform where we open, how we open, and who we're opening for. The other thing that we're doing is we're getting very, creative, innovative around where we open. So we're part of an opportunity zone deal on the south side of Richmond. We have a 20-year lease with a developer who is a friend of the YW and has a 5-year fundraising plan with us. The reality of that is we can't pay market rate, and that is simple and straightforward. And so we have to be very careful about making sure we don't step into leases that we can't then sustain. The other piece of that is our teacher retention. Today, we have 15 teachers going through the early education pipeline here at Reynolds. Couldn't be more proud of that relationship. They're actually working and getting their CDA or hopefully eventually their associates in early education at the YWCA. And so that is a partnership that came from the Fast Track program out of BCF. And the reality of being able to see how that could work helped us spur a little bit more thought around what we need to be able to create quality inside of our classrooms. We are not hiring, right, the quality teacher that is caring for our child today, but we are able to train them. And so thinking about how we create that pipeline and using dollars to be able to do things like sub pools, et cetera, would be very helpful. So the capital startup is a must need. The reality of training teachers is another. And then understanding that if we're going to serve families that need us most, in my opinion, right, needing affordable high care, full day, full year childcare and early education, we're going to need to come up with a plan to be able to serve them for at least birth through those 5 years in a way that makes sense for our operating budget. And we can see a path forward as a board that is operating a pretty complex organization.
Great. Anything to add, Jennifer?
No, because I think what I would say that first of all would enable us to open every one of our classrooms and have them fully staffed. So we would have, we'd be at 200 children in Newport News, we'd be at the 120 children in Hampton. I do think it would help us be able to look to say, okay, can we grow again and can we do another center? Could we partner with a locality like we did where we are now? The city of Newport News built the center at no cost to us for us. So could we look for other partners like that who could help? To add to your mention of the community college, in the new center in Newport News, Virginia Peninsula Community College is teaching its early childhood education courses right in the facility. So we have been able to hire a few more out of VPCC because they're right there. They're in and out of our classrooms. So I do think looking for some other partnerships will certainly help us in the future. But I cannot stress enough, even with those partnerships, having ongoing funding that is truly helping to assist with the total cost of high quality is very important.
Great, thank you. And so the last kind of lightning round for us, and we'll start with Sonia. And so what are the two things you would like the commission to know from your perspective? So from your lens and your expertise, what is the biggest gap in our knowledge or funding, or what's the biggest problem area that we ought to be addressing in this sphere? And then the one or two best levers or strategies that would help us to succeed in expanding and making sure we've got a stable early childhood care and education system.
Yeah, I mean, so I think one of the things came up in the last panel, which is this conundrum of needing to see. So, Jennifer was talking about losing employees to the school system. That's the other thing we hear, right? So it's like a Chick-fil-A or Target, or it is to a school system that that pays much higher for work that in some cases is rather similar depending on what your age is. So how do we kind of square this conundrum of needing to see early care educators as educators, train them as such, pay them as such? So how do we do that while also recognizing that the average household, even the average household, is not going to be able to pay any more, than they are currently paying. Even the people who can pay full pay, which is such a privilege to be able to actually pay, are often not fully covering the costs because there is a limit to what the median household, or 175% of median or 200% of median can pay. So I think that's one huge thing. And like, how do you think about that? I mean, I think RUPA, VCF has certainly thought about this. The Shovel Ready Task Force thought about this. What are the partnerships? What are the creative funding? What are the ways that we can think about training? Think about, combining, say, the training programs with a middle school or a high school, to kind of change that mindset as well. So it's like simultaneous, I think, sort of finding creative ways to train and provide sort of, and provide sort of higher wages, and then also sort of change our mindset around what it means to be an early educator. I think the second piece of it is that other 40%, right? So you have 60% on wages. How do we think about reducing costs in that other 40% so that more money can go to wages? And one of the, I've really enjoyed sort of being able to see some of the creative things that programs are doing across the 5th Federal Reserve District to, kind of involve philanthropy or involve public funding, or, find a friendly donor who can help you with those capital costs, which can then sort of increase the amount that you can put towards wages and benefits.
Great, and thank you. And I think that's a really great point, is how do we as a state or as public-private partnerships help to reduce the other costs in order to be able to free up money for the really important part, which is compensation. I would, before you pass that mic, be interested in terms of, so we have a gap between what the market will bear now in terms of what you're paying a provider versus the amount that they would actually need to be paid in order to attract a talent pipeline that's more sustainable. So without even thinking about early childhood education specific, I'm curious in what your thoughts are on the tools that the government can use to help mitigate that gap. And so tax credits, grants, training, I guess in your experience, what's kind of the most effective way of bridging that?
I mean, I agree with an earlier comment about EITC. I think EITC is a pretty powerful tool. So I've actually, I think this multi-share like try share plus philanthropy, what I would quad share model, I think is a kind of a compelling one because, and I think this is a really good moment to explore that because everybody recognizes this need. This is much less siloed conversation, I feel like, than what I've been seeing than it was 10 or 15 years ago, because employers are looking for workers, because, parents are looking for childcare, because policymakers are trying to figure out how to think about today's workforce and tomorrow's workforce. So I think that there are tools that the state, or that can be used at the state or federal or even to some extent local level, that can work in conjunction with some of the carrots that are needed by sort of some of the other partners. I can think about like subsidies that follow the kid, right? So this tri-share program, I think, is a nice. Now there have been some challenges in some states, right? Making sure that. Or there can be challenges. We've heard of some challenges keeping the employer involved over the long run. It can be a challenge in a more rural area where you don't have one large employer who can sort of contribute to that. So we have to think a little bit creatively. But I think it's within that partnership where the state and federal tools can be the most useful.
Great, thank you very much. All right, Jennifer, so biggest gap, problem, and then given the audience, some of your, what do you think are the best levers and strategies that we ought to be considering?
So I just think the biggest gap problem is that gap in funding right now between what it costs us to provide that quality program and then what we're receiving, whether through those subsidy program. And, we know we're creating our own gap with our families on that sliding scale. I do want to say that no family pays the true cost of the quality education in our center. Doesn't matter what your income is, because the true cost is just so high for families, especially with our littlest ones. So to me, that gap right now is the biggest gap. And yes, we're successfully fundraising right now, but if the market crashes, we might not be successfully fundraising anymore. That's maybe nervous too. So we've got to have that consistent funding for us for that 49% that I know we're going to get it. It's going to cover the cost of a quality program. It'll be re-benchmarked, whether it's by, every 2 years, every 3 years, so that we know that we're actually now, getting the funds to pay for what we actually need. Some kind of funding formula would be quite helpful. Never thought that you'd hear me say this, but things in public ed like the LCI, standards of quality, there are some ways that's being done in public education. How can we do something like that here for childcare? The work that we do is so incredibly important, both in terms of keeping our families in the workforce, hopefully helping them lift themselves out of poverty and helping businesses continue to thrive, but also having our children ready. I heard this yesterday just to emphasize how important it is that we close that gap. We had a parent who enrolled an infant with us. She walked on the tour into the infant classroom and asked where the TVs were. Where are the TVs? So our staff member says, well, we don't have any TVs in here. Why are you asking about TVs? Well, how are the kids going to learn if they don't have TVs in the room? That tells you what's going on for our parents who do not have children in high quality programs. So we have got to close the gap, because TVs are not going to be what helps our kids get ready to leave us successfully for kindergarten. So just a plea. We need help out here.
Great, thank you. Ruba.
I would say more money for childcare subsidy immediately. Moving folks off that wait list is a high priority for the Sprout schools, our region, and for working families in probably across the state. The other thing is to really think about that capital upstart, thinking about how to take folks from owning a family day home to being a business owner, right? Some of the similar issues that we're facing around scaling and really thinking about operating costs and into the future. Those are things that I think our family day homes are thinking about as well. Like, how do I do this for the long term? So There's some enterprise opportunities there. There's some capital opportunities there, and certainly immediately getting folks off that wait list so they can get subsidies to have childcare today. I mentioned we have 100 open spots today. We get a call every day for somebody looking for childcare that is either free or very reduced. And unless they have subsidy attached to them, our model today, we cannot accept them. So every single day we are turning away families for childcare.
Right, thank you very much. So no easy solutions, but some absolutely fantastic insights from our panelists. Thank you very much. Let's give them a big round of applause. All right, and I'll turn things back over to Elliot.
All right, well, in the parlance of the airlines, we're going to make up some time in the air. I know we're a little bit behind schedule, but I really want to make sure that we spend some time as a group on this discussion. So I know we've got an update from Delegate Bulva at the end and then public participation. Is there anyone signed up for public participation yet? Okay, so we'll make sure there's some time for that, but we're going to come close to the end with the next two items on the agenda, which are first to do the debrief of this particular session, and then to do a sort of broader look at both sessions and place those in the context of our values. So for now, again, if you were taking notes, take a minute or two to organize what are your top couple of both gaps you've seen, from this panel that was focused much more sort of a provider level. And what are your gaps and what are some strategies that you would like to see implemented? I'll give you just a minute or two to organize that, excuse me, and then we'll come back together and talk about it as a group. All right, do we have any brave volunteers willing to start us off? Talking about some of the gaps.
This is a continuation of my previous comments. So there's a gap between being a school teacher in a pre-K and being one in a kindergarten in public schools. The solution should be making the pre-Ks part of the public schools, and all the teachers will be on the same salary scale at that point.
First of all, that was a really, really great panel. Thank you to everybody involved for that. Two thoughts. These are both like really, really, really like kind of early stage in terms of the thinking, but I mean, obviously the easy answer in terms of the mechanics is just more public money. It's also the really hard answer politically. Two thoughts that are kind of outside the box that came to mind for me. First of all, I had the chance to ask Rupa, who I don't think is in here right now, but thank you, Rupa, about this Richmond Trust Fund. How did it come to be, and what does it do, and how common is it? And the most important thing she told me was that, well, it's really uncommon. It's really uncommon to have like a local trust fund to help kind of top up slots. So it just got me thinking about this massive wealth transfer that's about to happen in America, baby boomers dying, and like, how do we kind of use that moment for the right things, like, investing in, say early childhood versus yachts, and like what could we do to help, to help kind of get those dollars to the right places. And, I mean, just one thought, for example, is, what if there was some kind of there's a lot of ways to do this. One thought at the state level is, some kind of a matching fund to sort of incentivize dollars going into that sort of thing. It'd be kind of a good use of one-time money, potentially, once we fully fund site development in Virginia. The other idea is social impact bonds, which I understand, well, I don't understand them super well, but I think the basic idea is it's a solution to the dilemma that was posed by Delegate Bulova, which is like, how do you make massive public investment now, knowing that it's going to take, a couple of generations to sort of, see the benefits of that? Well, if you look at, James Heckman's and others' research, the ROI on these investments is massive, but it takes a long time to reap it. And social impact bonds provide a way to, essentially, open that up to investors, who want to get some of the, the benefits of that ROI. So anyway, I would just throw those two ideas out as, some things that we might want to explore.
Thank you. Other gaps that people want to identify?
I take the mic with the provision that you won't be upset if I mix a gap with a solution. I don't want to get yelled at. But for me, the gap that really stood out was what the market will bear in terms of what providers are getting paid versus the salary that they really need in order to stabilize the workforce. And that of course is manifested in just that huge amount of turnover, which ultimately costs everybody money. And it's a loss of investments that they're making in those individuals. But one of the things that I kept hearing up there was the assistance with capital infrastructure. And I liked that because it is a one-time thing that the state can do. And so, as appropriators, it always makes you a little bit nervous to make long-time commitments in new programs. But when we do have additional resources helping out with that capital infrastructure, and I kept thinking that what you could do, because you're relieving this organization or the child care provider of a major cost over the long term, and you could tie that with some kind of agreement that savings will go into supporting increases in compensation, right? And so they can come up with a business plan, they can kind of figure out how that works, but in exchange for the state doing a one-time, we're going to save you from having to have a mortgage on this facility, that money then has to go back into investing in additional salary for those providers.
Thank you. Other thoughts from the commission?
More just a statement about a lot of talk around compensation, and many of us hire a babysitter to go out to dinner and we pay them $20 an hour, to watch our kids. And as an educator, if I was paid $20 an hour per child that I taught, I would be making, like $40,000 a week. So if you compare it to what we pay just a normal babysitter compared to what we are paying our educators to educate our children and, look at our future of where we're going, there's a big gap of how we value education.
Anyone else? Delegate Quinn.
I think one of the other gaps that we have is we're trying to come up with one model, but to honor the different choices that we have. And not all choices look the same, right? They don't all cost the same. They don't have the same experience. Like we had a lot of amazing information from folks who are more based on centers, right? But like when I had my 3, I had one and I tried to use a center, but every day I got called for a sickness and I had to leave work. And it didn't work for me because I was like, if I wasn't at work, nothing worked. And being able to have that I think a gap is trying to figure out how do we honor in a system where we know different models cost different amounts, but empowering parents to have what they need to make the choices that they feel best are for their kids is another gap.
Other thoughts? I know we're behind time, but I do want to make sure people have a chance. Jenna.
In the spirit of sharing stats that I've often shared with other states, I often get asked about the workforce when I'm speaking at kind of national conferences and others. And what led to Virginia's shift away from market-based, using the market to set rates from childcare subsidy, to our cost of quality approach, which focuses on competitive compensation, although, as you noted, needs updating, was data from Virginia. And that data from Virginia that showed over 4,000 sites, we did survey data in partnership with UVA, that programs that took childcare subsidy, on average, were paying childcare teachers $2 less per hour, had twice as many vacancies, and found it twice as hard to hire. And so when other elected officials and stakeholders across the country ask me the question about what do you about workforce, I give them the same 3 words every single time. My team probably knows what I'm going to say. You got to fix your rates, right? That we know from Virginia data that even though there's a lot of things that go into the budgets, and even as Delegate Coiner noted, that there's incredible variety, that fixing the voucher rates or fixing the mixed delivery rates at scale enables providers to competitively compensate in the way that they need to for their particular jurisdiction, community, or region. And so I just want to kind of emphasize that there is we have economic data from Virginia that shows that the relationships, even though it feels indirect, that the relationship between how the state sets the rates has a direct sort of impact on empowering, without mandating any particular minimum wage, but empowers folks to do that. And that is the answer I give, across the country.
All right. Other thoughts? All right, I will try to sum that up. So we had a number of discussions of compensation gaps, right? Or gaps in the system in terms of the finances. And there were a few different ways that people came at that, all of which I think were really interesting. So one was, the gap between what pre-K teachers get paid and what K-12 teachers get paid, right? I mean, that is one gap that for providers is a really important one. Another important gap is the gap between what the public and the parents are paying for and what it actually costs the providers, right? That gap also, plays out in important ways. And, we talked about the gap even between what babysitters are getting paid and what our childcare workforce is getting paid. So those were all different ways of coming at a similar problem, which is basically that, our early care and education workforce is not getting paid enough. In terms of ways to address that, we had a few different ideas. I mean, John put out the idea of essentially sort of putting everybody on the K-12 pay scale. Delegate Coiner went sort of the opposite way and talked about, there are so many different models. You look at, the different number of different settings in which care and education are provided, and how can you be flexible with that? And Jenna noted that at the heart of all that is what is the rate that we're using, and that fixing those rates is a critical part of this. One other thing that came up that I think is really interesting, and potentially, again, all of these I'm putting out as things that the commission may want to delve into further, but the idea that in looking at the gap between what the public and parents can afford and what the service actually costs, right? Is there some way to come up with a third option, right? Like the trust fund option, social impact bonds, some other source of money that closes that gap. And again, there are a number of states that have or communities that have attempted that. There are real challenges to that, obviously. one of the spiciest panels I've ever been on in my career was about social impact bonds. I will not tell that story on the record, but if anyone wants to hear it after the meeting's over, happy to tell it. But again, there's a lot of work that could be done to think about, are there systemic strategies to close those gaps? The other thing I want to flag is this conversation about facilities that Delegate Bulova brought up, and that is different because it is often one-time money. But as we think about, when there are opportunities for one-time money, how are we using that most effectively to create greater support for, facilities and locations where services can be provided? I mean, again, like we talked about the model of how what is being spent on early care and education, and that personnel salaries are a huge percentage of it, but facilities are in many instances the next biggest chunk. And so how are we accounting for that? All right, so now I think we're up to green, yellow, red again. Does that sound like the conversation you just listened to? Hopefully green, but if anyone's got yellow or red, we'll address that. All right, anything online? All right, good. All right, so now we are trying to apply these conversations we've had to the values that we had articulated, right? So, Rebecca, can you, definitely don't need it at this point. Okay, so with regard to quality and compensation, again, we want to make sure that the cost of quality reflects competitive compensation to demonstrate the value of educators and support retention, that we have to have. All right, do you want to help explain this maybe a little, and then we'll talk, I'll go for it.
Yeah, sure. This is Karen's in my attempt to synthesize many comments across all of the members using very fat markers and not a lot of space on paper. But this is better than my drawings. So I think segueing from the quality and compensation, something that came up regularly in the sort of access and choice space that we heard are various strategies to address supply gaps, right? So thinking about investments in facilities and capital infrastructure, addressing challenges with zoning and land use, creating and kind of supporting providers as business owners and operators through peer and kind of mentoring opportunities that are supported by public funds. We also heard, as Elliot just alluded to, from Delegate Bulova, that the kind of idea around how are we then tying the cost savings that come from those sort of coverage of one-time uses of dollars to, and kind of making the most of those by tying that back to compensation and ensuring that providers are effectively applying those cost savings to invest in their staff, invest in their programs' growth over time. In the access and choice space, also heard a lot about maximizing supports for family childcare and ensuring that we're really leveraging family childcare homes as a viable option, that they are supported to be high quality, to be licensed or regulated if they wish to be, and to participate in public programs. And doing that kind of targeted supply building with an exceptional focus on family childcare as appropriate in rural areas where that is the best option for families, as well as thinking, kind of tying then all of these pieces around access, making a connection over to funding, ensuring that the funding models, as Delegate Coiner pointed out, are really honoring and empowering family choice across the variety of options, and recognizing that all of those options have different costs, both to families and to the state, and increasing family awareness of those options. I can pause or keep going.
No, go ahead.
All right. Over in the sort of value and return on investment category, we heard a lot from members around kind of thinking about and incorporating ROI into the way in which we're thinking about funding. So are we using ROI to inform different cost sharing models, or approaching or considering different models of funding a la social impact bonds that are looking at that kind of long-term ROI? we sort of slated this one in, though it probably could have fit in lots of different places. This idea of a playbook or a toolkit to support businesses and to support municipalities to engage and invest in early childhood care and education, whether that is through leveraging tax credits or whether that is through the tools that they might need to partner with providers in their area or to provide childcare themselves. In the stability and funding category, heard about keeping kind of cost of quality current to sort of keep pace with rising costs and tying again back to that kind of idea around competitive compensation and the quality and compensation value. Leveraging tax credits, both to promote individual affordability at the family level for those that wish to use more informal options and just kind of need that extra money in their pockets to afford that, as well as to leverage tax credits to incentivize business contributions to early care, ensuring that affordability for families is sort of factored in the ways in which we are thinking about funding and modeling costs. Leveraging tools like the digital wallet, which we just had our kickoff meeting for yesterday, exciting, to maximize and facilitate diverse contributors to the cost of early care, including and particularly small businesses and philanthropies. And then thinking about, things a la that like local trust fund or local local resources to contribute to that pot of available funding.
Thank you. So I think the good news of this is that it shows that the conversation we had last month where we articulated a set of values that matter for the early child care and education system were reflected in the conversation today, right? And that the strategies and gaps you were focused on and the activities you were focused on all in their own way relate to the values we've articulated. But again, I want to pause on that and make sure that if folks have anything they think we've missed or any thoughts they want to share about this summation, that they have an opportunity to do so, including the folks online. Does that, I didn't ask for an affirmative like show of green, but am I getting the sense that like this is capturing what we were talking about? All right, good. So that is really helpful, and we will be processing all this and bringing it back, sort of trying to keep building on this at our next meeting. But hold on, let me just check my notes to make sure there's nothing else I'm supposed to do before I turn it back to Delegate Bulova. But I think I'm close. I think I'm good. All right, thank you.
All right, I've got 15 minutes. I'm going to use every single second. And I heard no laughs, which means everybody is exhausted. So I really, my role now is to help connect some of the dots in terms of what we heard today, and then to preview what we're going to be considering, or at least one of the issues that we're going to be considering at our September meeting, because it really drew very heavily from today's panel discussions. And so over the last couple of months, we have had a commission work group that's been meeting to consider one of the bills that was referred to this commission. And so just remember, similar to last year, we've developed ourselves a good reputation, and it's a place where if a bill is not ready for prime time, if there's issues or details need to be worked out, the General Assembly sends it over to the Early Childhood Care and Education Commission, where we try to flesh those things out. And that's a really, really useful function that we have in addition to all of our other things that we are responsible for. And so in this one in particular was House Bill 2538. I forget what the number of the Senate bill is, but this is an effort that myself and Senator Locke went ahead and introduced this last session, which would establish an early childhood care and education funding formula within the Department of Education. And so part of our challenge, because we were able to come up with what this might look like in code, we've had some conversations, feel relatively comfortable that what we've put on paper is flexible enough to accommodate several different models. But the harder part, quite honestly, is articulating what is the problem that we are trying to solve, right? Because that's ultimately what House and Senate Finance and Appropriations are going to look at and say, all right, we can understand the mechanics of that. What is it that we are actually solving if we adopt some kind of funding formula? And so today's panel presentations really helped us to better understand why that's the case, right? And so, you know, particularly with respect to childcare and economic development, but I thought it was really important when we talked about the revenue stability part. And in fact, I know one of our presenters actually mentioned the idea hesitantly of perhaps we do need a funding formula like what we do for K through 12 education in order to provide some more transparency, some more predictability, make sure that it's data driven, and that we can all agree that yes, this is a good way of predicting how much money we need in order to be able to deliver quality services. And so that is something that we are doing in the background, and we're looking forward to presenting back out at the September meeting. But this will be something very tangible, again, where we're expected to provide a report back to the General Assembly, not just in terms of what that funding formula would look like, but ultimately, you know, what is it that we're trying to accomplish? How does it help to move the ball and move the conversation along with respect to achieving our vision for quality early childhood care? So anyways, all the discussion that we've had today has been really, really important. Again, it's been designed to help us focus our efforts in terms of what we want to go into our report to the General Assembly. So the funding formula is part of that, but there's a lot more, of course, that we'll be going through at September and making sure that we're on the same page together where we take the next steps for our system. So again, before I turn things over to Carrie, I just want to say thank you to all of our panelists. I thought they all were just absolutely terrific. We probably could have sat here for another couple of hours as we picked their brains, but that was really, really valuable, and I appreciate their time and expertise. So I'll turn this over to Carrie.
Thank you, David. You did a great job moderating today and keeping us almost on schedule, so I appreciate it. At this point, we will hear public comment. For those of you wishing to comment verbally this afternoon, please come forward. This microphone right up in front of me on the floor is live. And I would ask you to note that you have 3 minutes for your comments. Thank you for speaking today. You can come right up here to this microphone.
Hello, I'm Dawn Alt, the Executive Director of the Virginia Head Start Association, and I have Catherine Massey here, our Policy Director, with us. And I want to thank Simon Fiscus, Executive Director of Skyline CAP, who serves on this commission, who's here virtually, who has been representing Head Start, and also Tondwa Jeffries, the Executive Director for the Head Start State Collaboration Office out of Jenna Conway's office, has been instrumental in all the work for federal funding and early childhood in Virginia. I just wanted to make a comment that we are dealing with all of the same things that we've heard about today. And Virginia gets $177 million annually from the federal government through HHS. And rounding figures, we serve about 14,000 children and families, 17,000 if you consider it cumulatively for those that move out, we replace them, and it's 3,800 jobs in Virginia alone. And we are struggling with all the same things with pay parity, staff retention, lack of full enrollment because of staff shortages, and of course, you know, we're facing uncertain times with federal funding. We've had funding delays this last spring. Even though money was appropriated, the DOGE enacted Defend the Spend emails and caused a lot of delays, which caused a lot of uncertainty, and some of our programs had to close temporarily because they couldn't make payroll. And as we're entering this budget cycle, we are proposed for flat funding for the same as fiscal year 24, which is really good considering a lot of other programs that our families rely on for comprehensive services are slated to be cut from the federal government. However, we are furthering the truth that we are not able to keep up with the cost of living as well. And so I guess what I wanted to say about this is we appreciate all that Virginia Early Childhood System is doing for all the children and families. But as we move forward, especially in uncertain times, we just want us all to be aware that Head Start is a comprehensive program, two-generation approach that works with the children and the families. And for example, we can help families that are currently unemployed be enrolled, have safe, quality childcare, and then our caseworkers and home visitors help them get employed, and they can maintain their Head Start enrollment throughout that program year. So I just want you all to know that we're here and that we thank you for all that you do, and that there's a lot of uncertainty coming forward, and we would like to be in the conversations and how we can help Virginia move forward. Thank you.
Thank you. Any other public comments? All right, as we proceed to adjournment, I'd like to thank each of you for your time, energy, and dedication, and we will see you back next month.